talked before, this is a special time and calls for special arrangements. And we normally would be at Islamic House of Wisdom at this time of the year, trying to get everybody together to talk about community engagement, to talk about what we can do for the community, and at the same time to rally support for the programs that we offer at Islamic House of Wisdom. However, as I said before, this is a different time. We're bound to home, and we want to make the best of it. And this is a great opportunity. We can bring in some of the good minds and good people, hardworking people in the community. Before we start our live community engagement from the Islamic House of Wisdom, I'm going to ask Imam Elahi for a minute or two, just to give us an introduction. Please go ahead, Imam.
Thank you, Said Khalil. I want to say salam to everyone, and thank you, the panelists, and everyone who is joining us in Michigan, United States, anywhere in the world, inshallah, whether they watch us live now or they will watch us later on, saying congratulations in advance. يعني نحن نقترب من شهر رمضان المبارك بعد أيام، يعني الجمعة القادمة إن شاء الله. So I would like to say happy Ramadan in advance to everyone. نسأل الله سبحانه وتعالى الخير واليمن والبركة والصحة والعافية لكل المؤمنين والمؤمنات وللناس جميعا. Wish everyone the best. There is a hadith from Holy Prophet, peace be upon him, إن لربكم في أيام دهركم نفحات فتعرضوا لها لعل أحدكم أن تصيبه منها نفحة لا يشقى بعدها أبدا. The Holy Prophet said that during your lifetime there are opportunities of blessings and barakah that we consider those opportunities very, very heavenly, that Allah is there to bless you and provide you with the heavenly gift and heavenly grace. And if you are there on right time and ready to receive the reward and the gift of God, so you are going to be successful forever. And one of those greatest opportunities in our life, holy month of Ramadan, so grateful that Allah is giving us, inshallah, this opportunity to have another holy month of Ramadan, an opportunity of really change, transformation, a revolution in our ruh, a transformation in our life, and answering this question of how to be successful in life. And I think every key of success in our life is provided by the opportunity of the holy month of Ramadan. If you are asking people how to be successful, if there is a real reason for anyone success, real success in this life, that is going to be achieved in the season of Siyam, season of salvation of soul, the holy month of Ramadan. As inshallah today, as we are going to listen to our speakers and the panelists, starting from Brother Wassim, Mahfouz, I like our listeners and participants, friends, family members, anybody who is following this program today to please listen carefully and make note of what you can learn from presentations of our participants today, and make sure that as you are starting this holy month of Ramadan, you are going to make a huge change in your life and apply the things that you learn and follow the guidelines that you receive from our guest panelists, inshallah. So inshallah, I'm going to have more time during the program, but I let you to start. Said Khalil, go ahead.
Yes, thank you, Imam. And with us, Wassim, Mahfouz, one of the hardest working leaders in our community. We really appreciate everything you do, and his team. Please, Wassim, introduce yourself and your team, and you know what you do in the community, and a little bit about your organization.
Sure. Thank you so much, brother Khalil, and thank you so much, Imam Elahi, for allowing us the opportunity to be here today. The Islamic House of Wisdom has been a jewel in the crown of our community. It's not only a mosque where people go and pray, it's also a university where people learn about important topics, addresses various topics that are near and dear to everybody's life, whether it's health, education, youth development, religion, and you are to be commended for all the great work that you have been doing throughout the years.
Thank you.
Also, I would like to offer my deepest condolences on the loss of your mother, inshallah taslamu. And also, I would like to offer my heartfelt condolences to all those who lost their battle to COVID-19, this pandemic that affected many lives and many people in our community. And I would like to offer also my support to all those who are fighting strong, whether they are medical professionals, whether there are families who are battling COVID-19 as we speak. So inshallah, as we approach the month of Ramadan, all we can do is pray to God that He showers us with His blessings and the health that we all need during these trying times.
Thank you, Wassim.
I'm joined today by my team. We have Amira Haidar and Omnia Abdullah. They are our prevention specialists at LEHC. They work under our substance abuse prevention program. And I also have two of my program managers who are tuning in. Mariam Ismail, she's our substance abuse prevention program manager. And Marcy Masney, she's our healthy living program manager. And inshallah, during the month of Ramadan, we will come back to you with more in-depth presentations about substance abuse prevention and about Ramadan and healthy eating and healthy living. But in a nutshell, LEHC is a human services organization that has been serving the community in Southeast Michigan for the past 30 years. We provide the programs focused on education and youth development, public health, and a wide array of social services. One of our last activities that we've organized in response to COVID-19 was a partnership with the Office of the Wayne County Executive, Meyer and Kroger, and the Children's Foundation. We've distributed nearly $15,000 in grocery store or in gift cards to grocery stores such as Meyer and Kroger to income eligible families and food insecure families in our community. I understand that today's topic is going to be substance abuse prevention, and to that effect, I've invited, as I mentioned, two of my prevention specialists at LEHC, Amira Haidar, who will be speaking more about this topic.
Okay. Welcome, Amira.
Hi, thank you for having me. As Wassim mentioned, I am a substance abuse professionalist with LAHC. We work primarily with youth and with preventing substance use in the community. We teach them skills as well that help them gain these. We teach them these skills that help them gain knowledge on why not to go down the path of addiction or using drugs. I have just a brief presentation to share.
Okay.
Okay. Seems that screen sharing is disabled. I guess I can speak on it very quickly. With what we do, it's primarily, again, drug abuse prevention. The prevention is focused on education, which is what we do. We're usually in schools talking about prevention speaking about drug abuse prevention. Primary topic we discuss a lot is mental health and its relation to drug abuse. Of course, it all starts in our brain. a lot of times, many people, and youth especially, they turn to drugs as a coping mechanism because of mental health. They use it as a form of self-medication for temporary relief. They may also use it due to peer pressure or out of boredom or wanting to feel better because of certain life experiences they may be facing. Of course, drugs can affect the brain circuit and kind of trick us into believing that it's helping us when in reality it's harming us. The user ultimately becomes reliant on drugs and they feel that they cannot function without it. They begin to build tolerance, which ultimately leads to addiction. Drugs, of course, they cause this like temporary happiness, numbness, or distraction, which is where that self-medication comes in to the youth. Of course,
how long have you been doing that, Amira?
So I actually began in September.
Okay.
We go to schools in Wayne County, primarily Dearborn Heights community, and we speak to high school students and middle school students. We teach them skills such as goal setting, decision making. We inform them about different drugs, about tobacco, about alcohol, and how they can harm their bodies, and of course why they should not be using those substances.
What kind of reception do you get from students?
So the way we do it is we try to be as interactive as possible. We are in classroom settings usually, and we give them the information through different exercises and activities, and generally the students are very excited to participate in those activities. We always try to get their feedback, and generally they're very happy with what we provide them with, the information we provide them with. They always leave learning something new, and they're excited for seeing us again for another session in order to learn more about, gain new skills and experiences as well, and learn why drugs are not good for them, of course.
This is something very important. What you guys are doing is so essential. And testament to that is, all of the lives that we have lost, in the past to drugs. How are we navigating the taboo issue of talking about drugs?
So that's actually a very large misconception, especially in this community, that talking about it will introduce them to it and then they'll want to try it. When it's actually the opposite, because the way we introduce the topic of drugs and addiction to them is in a way where it's harmful for you. We're giving them the facts right away. We're telling them, we're letting them know exactly why you should not be participating in these activities, and we also give them alternatives for better coping mechanism, of course. It's a big stigma, of course, because people believe there's like shame associated with it, especially in minority communities, in religious minorities, or majority if in Dearborn, of course. We have a big Arab American and Muslim community, and so people are afraid to seek treatment. People are afraid to reach out for help. And so with this, we're going towards the youth, of course, we're letting them know from the beginning that there's no shame associated. It's better to get treatment and to receive help and to grow from this, and to move past it rather than succumb to it and ultimately die from it as well.
What kind of success have you had?
I would say that because we are in the classrooms, a lot of students would always tell me, they build trust in us, they confide in us, they tell us that I learned this new skill. I actually had one student before tell me, when you guys taught us how to deal with peer pressure and how to say no to people who are trying to peer pressure us, I learned to just leave the situation and not participate in, I believe it was vaping at the time. So we're teaching them these skills and they're actually applying them and they're letting us know that they're working.
Absolutely. Is there anybody from the team gonna share some other information, because we don't have a lot of time, or do you want Amira to continue talking about the program?
So basically, as I mentioned, inshallah, we will be back during the month of Ramadan. We will have like an entire hour to address the topic of substance abuse. But one thing pertaining to stigma and the taboo that involves substance abuse, when we started the program, we named the Life Skills Roots to Grow, because we want to a name that will not scare people away and to be able to allow it in the school system. Today, we've come a long way. We call it substance abuse prevention. We offer the program in over 25 school sites and community organizations throughout Wayne County. We address the topic with both youth and parents about why it's important to seek help. mental health and suicide and substance abuse prevention. These are very interconnected topics, and you cannot address one and leave the other.
Excellent.
And alhamdulillah, I believe we've come a long way as a community. Many families before, they were ashamed to talk about the topic of substance abuse. They were even ashamed to seek help. Nowadays, you will see more noise that is being made around this topic, and more people are going out of their comfort zone in that shell and seeking help, whether for themselves or their loved ones. But inshallah, as I mentioned, during the month of Ramadan, we will be back with more details. Amira had a PowerPoint presentation prepared for us today, but she couldn't share it with us. But inshallah, during the month of Ramadan, we will be able to make better arrangements.
We still have a few minutes left. If somebody on your team wants to say a few things, that's perfectly okay. Because we started a little, we pushed you from 2 to 2:05, so we still have a few minutes for anybody on your team to tell us a little bit more about it. Also, we need to give the phone number and how can people reach you, so they can, hopefully in the future we can cooperate between Islamic House of Wisdom and your organization to bring the program to the mosque and help people there as well.
And we
Absolutely
really appreciate what Brother Wassim and his team are doing. Your leadership and your courage, your commitment is very, very encouraging. I think you already made a lot of differences in the community, and we can see a big change of more people are getting involved and speaking about these issues and fighting this stigma and getting out of the boxes and seeing that this matter is very serious. We cannot just be in the position of denial and keep denying the thing. If we close our eyes and our ears, and denying doesn't solve the problem. And we encourage we are encouraged with your leadership and your courage, actually. Go ahead.
Thank you so much, Imam. We learned from the best. You are a leader in this community, and in 2015, LAHC established the ACT Drug-Free Community Coalition. And just to talk about the partnership that we have with the Islamic House of Wisdom, actually Imam Elahi is one of the board members of this coalition. And inshallah, we would love to be able to host more sessions with youth and families at the Islamic House of Wisdom after this quarantine is over, where we have more face-to-face interaction, inshallah.
Okay. If somebody needs to reach you, how can they reach you?
Our phone number is 1-800-352-LAHC. 1-800-352-LAHC.
Yeah. One thing I also like you to mention very quickly, you have a great program, it's the scholarship program, and you help a lot of people. Some of the people you've helped have gone to wonderful things. Just in 1 minute that we have left, could you just tell us a little bit more about it?
Absolutely. Our scholarship program, we've awarded nearly $1.7 million in scholarships, and we're accepting applications as we speak. Due to COVID-19, we've even extended the deadline of the scholarship application. This program is open to high school students, senior high school students who are college bound. The amount of the scholarship ranges between $1,000 all the way up to $5,000. They can go on the LAHC's website, lahc.org/scholarship, and they can find the application as well as the required documents they need to submit on our website.
Sounds good. I want to thank you so much for taking the time to be with us, and all your team, and specifically Amira, because she spoke to us as well. Thank you so much for being with us. We'll definitely have an entire hour during Ramadan, and we can talk about the program in details, and we'll have the screen sharing working for you, Amira, so you can give your presentation. Thank you again. Appreciate it.
Thank you so much. Thank you, Brother Khalil. Thank you, Imam Elahi. Thank you, Sayyid Mahdi. For allowing us the opportunity to be here with you today, and thank you for the team. Ramadan Mubarak.
Inshallah,
Ramadan Mubarak to you.
The night of Brother Wassim, one of the nights of Ramadan, we would like you to again have a presentation, and you would have more time, about like half an hour, 40 minutes, one of the Ramadan services, because it's going to be virtual. Ramadan services of House of Wisdom is going to be online again. And we would like to have you one of those nights to join us. And, you know, the education that you just mentioned is very, very important. Ramadan is month of education. And we are going to have you to share with us your wisdom, your education, your experiences, your success, your communication with the community. God bless you and your team. Thank you.
Thank you so much. We will be honored. Thank you.
Thanks again. What, you know, as we explained to you earlier, these are different times, and you know, these are times that everybody is doing things differently, and Islamic House of Wisdom is one of these places that's doing things differently as well. And Mahdi is with us to tell us a little bit about the services that we're providing right now, that and how we modified our schedules at the Islamic House of Wisdom to serve the community.
First, I want to say assalamu alaikum for everybody who is joining us here today and for those who will be joining us throughout the program. Before I get started, thank you, Brother Wassim and Sister Amira and Sister Omnia for taking the time out of your Sunday and getting together. I know that you guys chose the best rooms inside of your houses to show the rest of us. You guys are looking better than ever. For those of you who are just joining us, you are witnessing history. This is the first program that Hajj Khalil and I are wearing a button-up suit, coat, and basketball shorts all together. Hajj Khalil, don't stand up. You might expose what we're wearing.
My pajamas? Okay.
You know, something interesting now that, you know, we're on the topic of the youth, before we get into some of the youth programs that the Islamic House of Wisdom has to offer. I was reading a story about Benjamin Franklin. And Benjamin Franklin was saying that, you know, when he was younger, when they would get around at the dinner table, his father would do something interesting. He would every night invite one of his neighbors to join them for dinner. And he said the reason was because his father would open up conversations that he knew his sons would benefit from. And Ben goes on to say, you know, we did not care about the taste of the food, no matter how good or how bad it was. What stuck with me after dinner, it wasn't the taste of the food, but it was the flavor of the conversation. What's more important than the roof over our heads is the family that's living under it. And I commend the team that Hajj Wassim has gathered to focus on the youth, because one thing that, if we want to take a look at this pandemic, one of the maybe advantages or opportunities that it has opened up is it really allows for family dinners to come back together, for people to sit down around the dinner table and have those important conversations so that people can feel more open to share within their families. The way our program is organized this afternoon is we will be visiting prominent topics relevant today with our guest panelists, as you see. In between, I'm going to bother you guys highlighting essential services that the Islamic House of Wisdom is providing at this very moment. I'm not going to be talking about programs that we offered in the past. I'm going to be illustrating some of the programs that we offer even during this horrible pandemic that we are going through. Many businesses have had to close. Many people are not able to work, but our masjid cannot afford to lose touch with our community. Our faith teaches us to adapt to the times, and we have done just that. So some of the youth programs offered at the Islamic House of Wisdom, just to go down through a thorough list here. The Youth of Wisdom, for example, the youth group at the masjid, on a weekly basis, on Thursday nights, right before Dua Kamal, it is engaging the youth in the community with game nights, with teaching important lessons that Ahlul Bayt has left us. The Arabic school programs have continued online using virtual meetings. Girl Scout programs has met every single week since the closing of schools to provide youth with an outlet to connect with friends, learn life skills, and continue with their mission to make the world a better place. This upcoming month of Ramadan, there's going to be a special series for the kids. Youth of Wisdom will be releasing their Ramadan programs later this week. So stay tuned on our social media to keep up to date with that. Islamic House of Wisdom is also offering tutors. You know, a lot of times it seems if I want to speak from what I'm seeing within my own family, some of my nephews, they think that just because they're in quarantine, it opens up a gateway to just have fun and play games, sometimes forgetting some of their commitments that they have to school. But the Islamic House of Wisdom is actually offering tutors that are ready to supplement with your children's general education requirements. If any of your children are in need of help, please feel free. Do not be shy to reach out to us, as we can connect your children with someone who can help with the homework and lessons.
So
now, I want to move on.
Mahdi, I want to ask you, normally by this time, we'll have our event at Islamic House of Wisdom where people can show their appreciation and show their support for Islamic House of Wisdom. And we're still operating, we're still working, we're still serving, and we still have expenses. How can people help and to support those programs we're going to be talking about throughout?
Absolutely. There's actually a link on our Facebook page that is right below this live link right now. It'll only take 1 minute just to click on that link. Just put in your general information, your payment information. If you want, you could also dial 313-359-1221. You can share with us just your name and your payment information, and you could be on your way.
Sounds good.
You want to repeat?
Now, what I will do is kind of share a couple. Yeah, I'll repeat. I'll repeat it at the end of each segment so that people are reminded of where they could go to support the Islamic House of Wisdom, and in general, in the wide scope of things, support their own community. Some of the things that we received at the Islamic House of Wisdom were letters. People in the community went out of their way to really express their appreciation for the Islamic House of Wisdom. And I want to kind of touch base on some of those letters that were shared with us throughout this program. One of the first letters that we received was from Dr. Mahmoud Al-Hadidi, who is the chairman of the MMCC organization. He says, Islamic House of Wisdom is a house of worship where I always felt at peace and welcome. The efforts of Imam Elahi and the board are truly appreciated when it comes to promoting unity, diversity, love, and tolerance in the community and in the country, and discouraging sectarian prejudice and hate speech. I wish the Islamic House of Wisdom many years of success and continued service to the community. Thank you, Dr. Mahmoud, for your kind words. Another letter that we received was from Catherine Danishvar. She says, growing up in the US, I looked for an anchor of faith, honor, and wisdom to inspire my spiritual and moral values. Not only did I find this beacon of hope in the Islamic House of Wisdom and Imam Elahi, but I have watched its interfaith values become a source of inspiration and hope for all. We are all connected to each other by our humanity and faith in the Almighty God. Thank you for opening your doors to everyone in need. And once again, thank you, Catherine, for sharing that with us. I want to now take the time to share with the crowd some of the generous donors who have donated thus far. Dr. Mohammad Ajjour, Hajj Mahmoud Muhajiri, Brother Abbas Harajli, Dr. Hassan Amirikia, Brother Bilal Hammoud, Hajj Charles Khalil, Brother Ali Joseph, and Dr. Muhammad Hanif. Thank you all for your generous donations. You know, the Islamic House of Wisdom, to share with the crowd. I would like to just illustrate that the Islamic House of Wisdom is still open daily. Our program services and outreach have increased. The building will undergo some minor changes in the start of May, so we are ready for the summer activities. The utility and staff are still being paid. We are looking to create jobs, provide training, and provide for those in need. We truly count on your support to assist in helping the community. Like I said, the link is available below. You could click on the link, share with us general information, your payment information. Also, if you would like, you could contact us at 313-359-1221. It'll only take 1 minute of your time just to share with us, you know, your name and your payment information so that we can continue these youth initiatives. And like I said, throughout the program, I will be discussing some of the other initiatives that we are doing as of this very moment. I'm not going to be talking about things that we've done in the past. I'm talking about things that we are continuing, even though we are going through this horrible pandemic.
Thank you. We appreciate it, Mahdi. And now we're going to move to be joined by Council Member, Dearborn Heights Council Member Dave Abdullah. Good afternoon.
Good afternoon. How are you, Habibi?
Good, good. How are you?
Alhamdulillah, alhamdulillah.
It's good to see you. Good to see you safe and healthy. And how has this affected your life, like everybody else here?
Well, you know, obviously it's an adjustment, it's a major adjustment for me. But the way I've always gone through life, whatever life gives you, you just go to the next phase, whatever it is that's your option. So, do I have the option of working? No. Do I have the option of doing things that I'd like to do? No. So then you just go to plan B and make the best of it. So what I've done is I've used the time to, you know, I've always worked out. I work out a little bit more. I've also used it to better sharpen my skill set. So I'm watching a lot of videos on mindset, on business, on religion. I'm on, like in this particular case, I'm on a lot of webinars, learning different things. So you just got to go to plan B, and plan B doesn't work, you go to plan C. C doesn't work, you go to, you know, D, and all the way to Z. And then when Z doesn't work, you go back to A. So I'm trying to do this as calmly as possible, and then just going about my life with the best, because I can't change it. Anything that's beyond my control, if you can't control it, I don't let it stress me out.
Absolutely.
Now, if I was sitting at home and I can go to work, yes, I would be stressed out.
Absolutely.
But because I can't control it, I just go to the next phase of my life. I don't let it.
Well, you know, what I love about what you're saying is the positive message. And, you know, exactly, there's nothing we can do about it. We have to adapt and move on.
You know, Khalil, something about, he just said it, never stops, never gave up, and he never gives up, and always a positive energy. Hajj Dave, God bless you for all your commitment and contribution to our community. And
alhamdulillah, that's an obligation upon all of us.
Absolutely. How has this affected the you know, the city and what the city does, and what are some of the services that continue to operate?
So so in terms of the city's definitely had an effect on it. What we did is we made a decision to get rid of, not get rid of, but not allow anybody to work that's not essential. So the only ones that are working right now in the city are people that have to work in the city. And anything that's non-essential has been completely put on hold. Everybody's working out of their homes. There are some directors of different departments that do come in occasionally into City Hall. They obviously practice social distancing. There's no meetings. There's been no city council meetings, although there is one coming up on the 28th. But there's been no city council meetings. All of it has been virtual and by phone calls. And the only thing that is happening is the things that are absolutely essential.
Are you going to hold that council meeting from home, or are you going to be?
So at this particular point, we've been debating back and forth. It was supposed to be a Zoom meeting, but now the council chair emailed us that it's going to be an actual regular meeting. So that just happened just a few minutes ago. So now we're in a debate over that. Me personally, I would rather have it as a Zoom meeting, because my personal belief is I think we have to be an example to all. I don't know, you know, the thought process, so I'm going to be looking into it after this.
Absolutely. Absolutely. What are some of the services that continue to operate that you deem essential?
So obviously, the police department is still operating, although nobody can come into the police department, but you can contact them via phone or email them, of course. The fire department, of course, is still working. And since I'm on that conversation right now, not only my salutes, but God bless them all for putting their lives on the line. We've had some people in the fire department that unfortunately had to go into quarantine because, you know, as you know, they're doing all kinds of fire runs and ambulance runs are coming in and out of houses. They are wearing the proper PPEs, but still, you know, you're always have a potential of something happening, and they are putting their lives on the line, and I salute them for that. You know, God bless them. And like I mentioned, the police department is still working. DPW, which is the Department of Public Works, is working on minimal staff right now. The garbage still operating properly. So anything that's essential for the livelihood of our residents is still operating.
Have you extended some of the deadlines for certain things that people used to go there and pay bills and so forth and so on, so they won't be paying?
People can still technically, people can still technically pay bills by dropping it off at City Hall. There's a drop box there. You can put in a copy of your whatever bill, or at least some information about your bill, your address, your phone number. And if you're looking to pay, you could pay it via check there and put it in the drop box. But we've definitely softened up on a lot of things because there's no choice. I mean, there's no other way to do this, obviously.
Yeah. Any plans for the election? Well, you know, what are we going to do? Are we gearing up to possibly do it online? You know, what are the?
It looks like right now I had a virtual meeting and conversation with the clerk, and pretty much it's going to be pretty much all by absentee ballots. I mean, that's what they're pushing for, everything to be by absentee ballot. We're trying to avoid as much as possible. Now, that's the clerk's decision in this particular case, but I'm just telling you what he's doing. As much as possible, people interacting with each other. When we had the elections early on in March, you know, you see people coming close to each other. You know, as much as people try to avoid it, the reality is you got to think of it this way. So like, let's say in my particular case, okay, I'll use myself as an example. I'm 54 years old. So for 54 years, I'm used to coming up to you and saying hello and maybe a hug, you know, and how are you, and having a close conversation. And then suddenly within minutes, we got to completely stop that. So it's kind of hard for people to do that. Even myself, when I've run into people, even though you know you're not supposed to shake hands, and I'm of course avoiding that, but it's an automatic reflex to shake hands. So that's why they've decided to try to avoid that as much as possible, make it all by absentee ballots, which is, you know, if you think about it, very easy. Now, I'm the wrong one to talk because I'm the one that has never voted absentee ballot. I've always voted in person, only because I feel this is such a great right that we have to do here in a great country. I don't know, in a weird way, enjoy the process of actually going out there, walking in and going through the process of voting, whereas by absentee feels like it's a non-vote. That's just me. But obviously, like everybody else, I'm going to have to follow the right protocols and go into voting via absentee. And since we're on that subject, highly, highly, highly recommend that everybody go out and vote, you know, via absentee in this particular case. You know, one of the things that really concerns me about a lot of people within our communities, the fact that they don't vote, where they say things like, well, you know, Khalil will say, well, you know, what's my vote? Just one vote. And I say, well, what's my vote? It's just one vote. And this guy says, what's my vote? It's just one vote. And it's something that's very, very, very important for our community and for our society. In addition to that, since I'm on that subject, the census.
Absolutely.
It's very important.
It's going to be my next question.
Yeah, it's very, very important that we all fill out the census. I filled it out. I mean, I think it took like 3 minutes maybe, you know, online. And there's 1-800 numbers you can, and there's all kinds of ways for you to be able to get that information to us. And that's going to have a major effect on our community in terms of schools, in terms of the amount of taxes that come into our community on the federal level, in terms of things for recreation, in terms of things for fire department, et cetera, et cetera, et cetera. That's all based on the census. And so as Arab Americans, it's very, very important that we get counted as Arab Americans, you know, and we get whatever is rightfully coming to us. So please make sure that you
on the census, you know, why is it so important?
Well, it's important because, like I said, that's the way they count the number of people in a particular city. But then you divide that up. That's the way they count how many Arab Americans are in a particular city, how many African Americans are in a particular city, et cetera, et cetera. And that's how funds are allocated. It's based on those numbers. So that is why in previous years, if you didn't fill it out online or what have you, they came right to your door and knocked on your door to try to get a census of who's in that household and how many people. So it's extremely important. Please, please, please don't take that lightly. Some people are afraid of sometimes filling it out, saying, oh, the government will now come after us, whatever. That is not what those numbers are used for. All it is just data collecting at this particular, not at this particular point. That's all it is. It's data collecting.
Yeah. And this is a perfect time to really use as an example, because now as the government is allocating funds and resources for those who are affected by the COVID-19, they're allocated and based on the numbers that they have. However, we know we have a lot more people in our community that could use the help, and either going to have to divide the funds, or some people going to be without any help because they didn't register.
Sure. And even people that have a challenge in language, like, and sometimes we got to be realistic about this. So I'll take, for example, my parents. I always like to use my own personal family as an example, so that nobody thinks I'm discriminating against them or say something about them. So my mom and dad, for example, they both speak English, but they're not at a high level of English. If somebody popped up at their door or sent them an email or something via mail, chances are they're not going to do it, because they're not going to know what it is unless they show it to somebody like me, which would show them what that is. So I do understand how some people can be a little apprehensive on filling out something like this. At the same time, you have access, for lack of a better word, to organizations such as Access that is more than willing to help you on something like this, help you fill it out. Of course, you have a lot of the jawama, the mosques that are willing to help. You have a lot of political figures that are willing to help. So I do understand when people are a little apprehensive because they don't know, but you have resources of people that you do trust that can tell you. So like, let's say I didn't speak, I wasn't very strong in English. But if I called you, Sayyid Khalil or Imam Elahi or Mahdi or anybody else, I'm sure obviously they would tell us, yeah, this is okay to fill out, and maybe even help us fill it out. And
Absolutely.
that's where, the lack of English is no longer an excuse.
Absolutely. And Islamic House of Wisdom has been at the forefront trying to rally support for the census even way before they started really counting. And, we've had tables in the Mahdi Hall and other places where people, and as you well know, you're no stranger to Islamic House of Wisdom.
Alhamdulillah, yeah.
So,
always at the forefront. So I've always been impressed with that.
What else can we do as an organization and the city to work together to help the community?
Well, what you can do is obviously I get a lot of calls on, because, my number is known based on being in real estate. A lot of people call me for things that really have nothing to do with the city councilman. But of course, as you know, my personality, I go out of my way to help the people.
Absolutely.
And sometimes we're getting calls on things that are really not imperative in this particular case. I'm talking about things that are really minute. And I have to, as much as I'd like to help people, I have to tell people this is all on hold right now. Sometimes people are not very understanding in this particular case why some of these things are on hold. Well, the reason they are on hold is because of the amount of manpower or woman power that we have in the city. You can't put all your human resources on the front lines. You can't put them on the streets because you can't put their lives on the line or the residents' lives on the line. So the biggest thing that residents can do right now is be very understanding that in these circumstances, it's a game changer. It's not the same as it's always been. Some things may have to be put on hold until we're back into normal activity, normal action. As it looks like right now, it may be May 1st, but as I've spoken with a lot of people about, just because May 1st comes around does not mean that the virus packed up their bags and went to the moon. It's still here. So we still have to be all very, very careful. This thing is going to be around until they find some sort of a
vaccine.
Vaccine for this virus. Otherwise, it's going to be around. So May 1st, it's not over. We have to all continue to do what needs to be done.
Absolutely. And now you have some of the people who are running for office this year. How this is going to impact campaigning?
It's been very, very challenging for people that are running for office. There's nothing running right now this year in our city, but it's been very challenging. I've been reading about somebody that's running. I'm trying to think. I forgot what he was running for, but you know how you have to get petitions signed, and he couldn't get enough petitions signed, so he was suing the state to allow him to have less petitions signed because he's not able to get petitions to be able to get on the ballot. So obviously that's going to be challenging. Going to different functions is going to be challenging. But here's the thing. We, just like in our real estate business right now, our real estate business is going to be totally changed from the way it used to be.
Sure.
The political world is going to be totally changed from the way it used to be. The voting we just talked about earlier, last year before this virus, the number of people that voted via absentee ballots, which means for those that are not familiar with that, you go into the clerk's office at City Hall, you get an actual same paper that you would when you go to vote, and you fill it out right there. And then if you'd like, or you could just, take it home and then bring it back later and turn it into the clerk's office, i.e. City Hall. And then your vote gets counted the same way. Last year, it was almost 60% of the people that voted via absentee ballot. Whereas before, it was a much, much lower percentage. I don't know the exact percentage, but I'd imagine it's probably 5, 10, maybe percent of people that voted that way. That was last year. Can you imagine now this year?
Yeah.
It's going to be way higher. So that's a game changer. So therefore, as a politician, if you're running for office, you got to change the way you run for office. For example, when people voted at the ballot box on, in November or in March or in April, whatever it happens to be, you used to be able to run your campaign all the way up to the day of the actual election. Well, now it's a game changer because people can vote by absentee. They can get their absentee ballots 30 days before. Therefore, you got to have your whole full presentation done a month before. And then you got to do things differently. You got to do things like maybe the Zoom call. You got to do things maybe a lot via social media. It's a total game changer.
Sure.
And I think it's a good thing. It's going to get us out of our comfort box. Look, I'd be the first to tell you myself, Zoom, I'd always heard the term Zoom. I had no idea what it is. Never been on it in my lifetime. But guess what?
Yeah.
I like it. I think it could serve a lot of good things. I could imagine right now, even in the what do you call it, in the religious world, at the masjid, at the masajid. You know, like if I want to speak with Imam Elahi, but I want to have a conversation with him one-on-one like this, you know, on a Sunday or on a Saturday, whatever, you could set up a Zoom meeting one-on-one with your Imam. It's just as if it's a virtual, actual meeting, but you do it this way.
Sure.
You know, real estate, a lot of negotiations are happening this way now. You know, in real estate, some house showings are happening via Zoom.
Yeah,
it's a whole new world, and I think it could be for the better overall.
Absolutely.
It's in politics. It's a game changer.
You and I are in real estate, and we both are seeing how right now everything is on hold. But you know, just wanted to ask you, where do you see the market, and what do you think is going to happen?
So let's talk about the market specifically, the Dearborn Heights market, which are a primary dominant area for a lot of the people listening on this call. And it's pretty much the same for the Tri-County area. One of the things that you'll notice in the real estate business in the last, you know, maybe 3-4 months is inventory has been very, very low.
Yeah.
Inventory was low as it was. So when people were making offers, a lot of times they had to go at asking price or a little bit over asking price. And what that did is that created the price to go up a little bit. And the reason it created the prices to go up a little bit is because you got less properties, less homes on the market than there is demand. So it's a simple law of supply and demand. Now with this coronavirus, it changed it even more. Now nobody can predict the future. All we can do is just look at either historical data in general, and make an educated prediction. Right now in Dearborn Heights, for example, which is where this message is at, in Dearborn Heights, there's currently on the market 105 houses for sale. Now, normal is 300, 400 houses for sale in the city. There's only 100 houses for sale. So let's take a look at the parameters and what's likely to happen. Nobody can predict the future, but what's likely to happen.
Sure.
You got interest rates now around 2.5% to 2.75%, okay? Rates have never been like that. There was only one time, I've been doing this for 31 years, real estate. There was only one time where it dropped in the 2s, and it was only for like a couple of hours, and it went right back up in the 3s and then back up further. So the reality is this is the lowest interest rates that we've ever had. Inventory is very, very low. And then for a lot of people that wanted to buy, it could not go out and look at houses, or people that are getting married, or people that are moving up, you know, move up type of buyers, or people buying investment properties. They're all going to get in all at once. Now, initially, there may be a little bit of a slowdown because people are still apprehensive, not knowing what to do based on the market, you know, based on their particular financial situation or employment situation. But once all of them get in all at once, and a low inventory and a low interest rate, that typically is a recipe for a strong market. But the coronavirus is the game changer. So it may end up being a wash, which would typically mean we may end up being with the same market we were just before we started. I've had a lot of clients contact me totally afraid that the market is going to crash. So basically meaning that their home that's worth $100,000 may become worth $60,000 like it was back in 2007 and 2008 when the market crashed. There's no indicators that that's going to happen. And the reason there's no indicators that it's going to happen is because the market crash in 2007, 8, and 9 was a lot of it because of the fact that the loan business
was
so easy, and easy is an understatement. It was nothing. Somebody can be brand new in the country that could get a loan. There was also what they call non-conforming loans. There was loans at 110%, meaning you buy a house for $100,000, they give you an extra $10,000 to your pocket as the buyer at the closing. There was no documentation loan, meaning you, Khalil, you apply for a $400,000 house, and they don't ask you any questions on income or anything like that. So there's a lot of what they call risky, very risky loans. Banks have gone way away from that. Therefore, with that not being around, as soon as people get back to their normal lives, we'll be okay. And I personally, I don't foresee any type of a crash. As a matter of fact, I see the possibility of a strong market.
Exactly, Bruce. I think we're going to be in the last quarter. We're going to be very busy. We're very busy.
Inshallah. Inshallah. And here's the thing I want to point out, Khalil.
Sure.
The real estate market is very, very, very important to the economy. You'll notice when the real estate market, when the real estate pricing crashed, so did the economy. And when the real estate market went up, so did the economy. They're directly tied to each other. And the reason they're directly tied to each other, and this is why the government is always pushing, lowering the interest rates and what have you for the prices to go up. Because as prices go up, so I have a $100,000 home. My home becomes worth 140, let's say, or 130. Now I have a lot more equity in my home. You know, I owe less money and I have a lot of money available to me. What typically happens a lot of times is a person will take money out of their home. They'll pull money by refinancing or pulling an equity line, whether it's 20,000 or 30,000 or 40,000. And then I take that money and I spend it on either a vacation, a boat, maybe another home, maybe buy some clothes, whatever it is. But that money goes into the system. When that money goes into the system, it's a domino effect. Then that person that I spent my money at has money to go spend somewhere else, and then that person has money to go spend somewhere else. And that's why the government is always pushing to have a stable real estate market. And I'm hoping and praying that our president looks at it that way.
Absolutely, absolutely. Dave, as always, I want to thank you for being with us. And if somebody needs to reach you in regard to the city and city business, how they can reach you?
They could contact me at 313-203-8215. I'd be more than happy to help them.
Thank you so much. I really appreciate your time being with us.
No problem.
And speaking of services and support, this is definitely the time to, go back to Mahdi and talk a little bit about, the other services that Islamic House Wisdom is providing. And Dave is right. These are different times, and these are the times that we need your help, so we can continue those services for the people who need them the most. There is no time like this time where Islamic House of Wisdom is doing an incredible job providing services to the people who need it the most. And I'm going to defer to Mahdi to tell us more about how you can support, and also how some of the other services we have.
But before let me just again thank you, Hajj Dave, for beautiful information. I know that in Ramadan, a lot of people used to do i'tikaf in the mosque. And since now we don't gather in the mosque, we need to do i'tikaf in our house. So having home matters at this time. And you gave good information about real estate. And we appreciate you to be really a role model, Hajj Dave. God bless you.
Thank you.
In your faith, in your humbleness, in your services, in being available, as you mentioned, to help everyone. So you are known for this humbleness and service to everyone. God bless you and your family.
Alhamdulillah. We learn from you, Imam. We learn from you, alhamdulillah.
Absolutely. We'll go to Mahdi, and Mahdi going to share some information with us.
Thank you, Hajj Dave, for joining and investing some of your time amongst the very busy schedule of webinars and so on and so forth. I really like the background that you have. I think what we're gonna do, we're gonna vote on who has the best background here, and then send them some kind of prize. A really beautiful background there.
This is where my wife has me quarantined, is in our library. So I'm here 27. She doesn't want me to get out of this room.
Right. Fantastic. And I know that you mentioned exercising. Something that the Youth of Wisdom is actually doing during the month of Ramadan is everybody is going to be encouraged to walk around their neighborhood, and then however long that they walk, the distance that they cover, send it to us. We're hitting for 1,400 miles in total for the remembrance of our 12th Imam, Imam Mahdi, Ajjour ta'ala Faraj al-Sharif. They call the era we are living in now the digital age. And in a way, it reflects the major advancement in technology. Some of the things that we are able to do now, like communicate by seeing one another, would have been unfathomable not too long ago. But something that this new age has brought more so than any other period in history is the focus on how to get what we want. We have become people who feel like they need to be served at a click of a button. The satisfaction of ourselves takes priority over all else. Why? Because we are under the impression that with our own satisfaction comes the highest form of happiness. But what we don't realize is that only thinking about our own needs buys a very limited form of happiness. And Allah solves this issue for us. He says, if we want to think that our existence is limited to this life, then that means we have limited happiness. So our faith provides us with a solution which guarantees the continuity of happiness after death. If we focus on not satisfying ourselves but Allah, because with His satisfaction comes eternal happiness. And one of the ways that we can satisfy Allah is by satisfying the needs of the people around us, by supporting our local initiatives and institutions like the Islamic House of Wisdom. So once again, thank you Hajj Dave for for taking time out of your day
My
and
pleasure. My pleasure.
informing the community. Send our salams to your family. Once again, I want to say assalamu alaikum for everybody who's joining us. It's the 25th year of the Islamic House of Wisdom being up and running and operating. This is the first fundraiser of the year, though. We're doing it virtually. Hopefully later on in the year, we're going to be able to sit together, maybe within 6 feet, if that's still going around with the guidelines. But nonetheless, we'll be able to hopefully enjoy a meal with one another with the second fundraising of the Islamic House of Wisdom. Before we move on to our next panelist, I want to highlight some of the social services that the Islamic House of Wisdom is providing. Since day number 1 of this COVID-19 crisis here in Michigan, the Islamic House of Wisdom has provided essential services to help the community. Daily food distribution. The mosque is preparing and handing out 1,000 meals daily, every single day. Everyone who can use a little extra help during this time is encouraged to stop by to pick up meals for themselves, their families, and friends. We need help delivering food to those in need. If you are interested in helping, please contact the office. Once again, there are many ways that you can support us today. There's a link on the Facebook that you're listening into now. If you do not want to go through that way, it takes less than 1 minute. Give us a phone call at 313-359-1221. Once again, 313-359-1221. And there's also a link below that you can click. Just give us your information. Less than 1 minute, you can support and satisfy not only your needs, but the needs of those in our community as well. We are collecting masks and cleaning supplies to donate to the local hospitals. If you'd like to assist, please drop off in support and helping those who are critically ill and in need at this time. Due to the unexpected and sudden deaths, and this is a very important service that the Islamic House of Wisdom is providing, the Islamic House of Wisdom urges everyone to help with the burial assistance program. You know, in the time of crisis, families are overwhelmed and can be drowned with many responsibilities. We want to make sure everyone is treated with dignity in their transition from this life and into the next. The Islamic House of Wisdom is offering its burial services. It's offering its memorial services for those who are in need. We offer our prayers and our condolences, and we recite dua for those that are critically ill. And we are very grateful for many of the healthcare providers who are risking not only their lives, but their families' lives at the end of the day to help treat those that are critically ill. I want to move on to 2 more letters that were shared with us. I think that it's important to get a different perspective on things. You know, hearing it from me, hearing it from Imam Elahi, hearing it from Hajj Khalil is one thing, but really hearing the appreciation and some of the thoughts of the people in regards to Islamic House of Wisdom, I think it's important to share from the Honorable Judge Hajj David Turfa. He writes, Salam. Wow, how time flies. In 25 glorious years, the Islamic House of Wisdom has been in the forefront of serving the community's religious and humanitarian needs. May God bless the hard work and effort of Imam Elahi and his staff and continue to keep the Islamic House of Wisdom strong and accessible to the community for 25 more years and beyond, inshallah. Thank you, Honorable Judge Hajj David Turfa, for your kind words. A letter from Imam Ali Layla. Under the leadership of Imam Elahi, he writes, the Islamic House of Wisdom has transformed over the years from a small place of worship to a vibrant center filled with activism, community service, spirituality, and civic engagement. Islamic House of Wisdom has been remarkably successful in building bridges of mutual respect and understanding among the diverse Muslim community as well as non-Muslims. It strove to connect its community to the Islamic traditions while bravely addressing many sensitive local, national, and international matters, which make IHW an excellent model for Islamic centers in the United States of America. I hope and pray that Islamic House of Wisdom will continue to spread the message of Islam in words and actions in the coming decades. Thank you, Imam Ali, for your kind words. And I want to recognize those that have donated thus far. Thank you to Dr. Paracha, Haji Vicky Ashkar, Mr. Abdulaziz, Bagoman, Brother Talal Turfa, Sister Mahnaz Mafi, Dr. Adam Harp, Brother Baha Saad, Sister Maryam Saad, Sister Kara Buto. Thank you very much. Thank you and your families. We hope best of health and safety for you and your loved ones. Thank you for helping. You know, you would think that with this pandemic, the mosque would not be able to continue functioning, but we are open every single day. Our programs continue. Outreach is as strong as ever. Our summer activities are set. We continue to pay for the utilities and our staff members, because we know that in times of need, it can be difficult to kind of gather funds, but we are continuing the payment and the salary of our staff so we can ensure that they and their loved ones are supported through this tough time. You can be a part of that support as well. You can receive that ajr as well by supporting. There is no wall between our mosque and the people. You know, a lot of times you hear the president wanting to build a wall, but there is no wall between the mosque and the people.
How can they help those who are listening to us, Mahdi? How they can help?
I mean, we're in this community. We're going down this path together. We're here for you. Now you be there for us and support with the link below on the Facebook Live that all of you are tuning into. There is a link below. You can click on that link, share with us your information, or you can give us a phone call. If you want to talk to somebody, I know it could be a little lonely nowadays. If you want to hear another voice, give us a call at 313-359-1221. That's 313-359-1221. Less than 1 minute, just your name and your payment information, and be a part of not only satisfying your own needs, but satisfying the needs of the people, which automatically satisfies satisfies Allah. And inshallah, you will be rewarded for that in this world and the hereafter.
Thank you so much, Mahdi. I really appreciate it. We're going to welcome Dr. Ajjour. Good afternoon, Dr. Ajjour.
Hello, good afternoon. Job well done.
Thank you. It's a pleasure that you're being with us. Dr. Ajjour was the founding chairman, Islamic House of Wisdom. Is one of a dear friend to every one of us, and a dear friend to Islamic House of Wisdom. He's a well-known cardiologist in the community, and we're so glad and so happy that you're with us. And you can, every year, Dr. Ajjour shares with us in the as you well know, I publish Michigan.com, and we publish a specific edition for Ramadan. And Dr. Ajjour helps us and support us all the time, and he supports us with information about Ramadan and fasting and how does it affect us, and we really, really appreciate it. So welcome, Doctor, and glad to see you safe and healthy.
Thank you. It's good to see everybody, and salam li Imam Elahi, the leader of this institution for 25 years, and these are the results of the seeds that we planted 25 years ago. I do encourage everybody to support the House of Wisdom in any way they can, because they have a lot of projects, a lot of expenses, and they really control their budget to the best of their ability. And this is a rough time. If one need to step up, that's the time we need all to step up and help.
Excellent.
You know, we got a quick course in real estate, so I learned a lot about it from. I'm gonna move it to the medical. Just cover a couple of things.
Okay.
First thing I want to cover is COVID-19, and quickly talk about fasting from medical point in the month of Ramadan. I'm not an infectious diseases specialist. I'm a cardiologist, but I'm involved a lot with the cardiac complication from COVID-19, and I have been seeing a lot of these complications. I kind of gonna answer some questions that people ask me, but you are welcome to ask me and stop me if you have any different questions. what are the symptoms of the COVID-19? And the main symptoms are, fever, shortness of breath, and cough. But really, we have seen a lot of different symptoms. Extreme fatigue. One day you're doing great, the next day you cannot move around. That's something is just not right. Severe pain, generalized pain. One of the patients, he had pain from his waist down, severe pain. Some people have loss of a smell and loss of taste. So it's really presenting in a different way. So if you have something different what's going on, I really think you need to be checked and evaluated. And I want to, some people call me and they said, please, don't mention anybody that I have that, nothing wrong with habit. You didn't do anything wrong. This is not a sexually transmitted disease. This is you were breathing, or somebody while talking just, some of these particles went to you. So you really need to know, and because you need to protect people around you, and just hiding it or not recognizing it not only cause harm for you, but could cause harm for other people. Another question people ask, if I have heart problem, I am, would be chances getting the COVID, the virus more than anybody else? The answer is no. Your chances same as anybody else, but you will be more complicated from it if you have some of these risks which we talk about: the high blood pressure, the diabetes, the heart disease, the lung disease, the COPD, cancer. All of these, if your immune system is low, that's really will be affected and will make it more complicated, the issue. The question, how do we avoid getting into it? You need to protect yourself. You need to protect yourself. We always talk about isolation. We all need, and this is a great, people think from now on, a lot of meeting gonna take this place, go in this direction. And we achieve what we want. We can see each other, we can discuss it. You need to be isolated. There's really no reason to be outside. And if you have to be outside, you need to wear a mask. And if you are elderly with a lot of risk factor, you need to stay indoor. You need to wash your hands. You need, really continuously with soap and water, and not just for a second. You need to wash for 20 seconds. So I have made a formula. If you say, Subhanallah, walhamdulillah, wa la ilaha illallah, wallahu akbar, 3 times while you are washing, that's exactly will be 20 seconds. So that will work. You would have wash your hands, and you would have wash your heart as well. You need to have social distance from other people. If you are smoking, you need to quit. If you are, don't exercise, even if you're at home, there's few things you can do. If you have a treadmill, a stationary bike, that'd be wonderful. But if not, just walking around in your room, if you have a couple of pounds and lifting the weight, going up and down, all of these really add to this. And it's not, we are super scared about it. We are very scary because we always hear the negative aspect from it. We hear somebody died, but look, there are a lot of people having it. Just to give you a run of what's going on. 30% of the people that get the virus, they don't know about it. So that's out. 30%, they have it, they develop antibodies, they recover, and they don't know about it. That's good and bad. It's good that they are healthy and they don't know about it. It's bad they could spread it and not knowing. And that's why you have to be aware of everybody and assume everybody could potentially have that head virus. 55%, they will have mild to moderate symptoms. And those also have no problem. They will recover nicely. So that's 85% of the people that have the problem. They will either recover or they wouldn't know about it, and there's no mortality in this group. Nobody will die, and they will not be hospitalized. Then we left with about 15%, about maybe 10% of those patients will be admitted, will be in oxygen, and will be recovering. Then we stay with the last group, which are the people, and I tell you, these are the go on the ventilator, and we're having a rough time getting them off the ventilator. one thing I found in common in all of this, and not in all of this, most of this, 90%, obesity. You know, we do not a lot of time consider obesity associated with this virus, but all of them are overweight and obese and becoming hard time. So the mortality of this is maybe 1.5%, and the problem with it is it's a lot higher than the flu, and it's more contagious than.
Doctor, why is obesity an issue here, becoming an issue?
No, we really don't know the answer, but I tell you, if you are obese, that means you don't exercise. And if you're obese, that means you don't have enough space in your lung. Most of the belly is pushing against your lung, and you are not in a good shape. So your immunity is down, your exercise level is down, and I think you can get in trouble easily. That's what we think is going on. We do not have any test to determine.
Dr. Ajjour, I had a question. You know, you mentioned ventilators. I've been hearing a lot that ventilators may not be the best route for every single patient that gets admitted into the hospital because it's such an invasive procedure. What is your feedback? What is your take on automatically starting people on ventilators? How is it really shown to be effective, or how does that work?
You know, ventilators should be the last resource. And a lot of patients that I see in the hospital, we really work so hard to avoid putting them in ventilator because we're having difficulty getting them off ventilators. The ventilator itself is not that bad, but at some stages, you know, your oxygen saturation normally, if we are doing good, should be 96, 97%. But when it starts dropping and you give them oxygen by mouth and oxygen by mask and all of this, and some of them are 40%. I mean, 40%. That means you're not perfusing the brain, you're not doing all of these, and we cannot bring it up. That's, you know, that virus, it does cause inflammatory effect in the lung. And it caused the lung to swell, and you have fluid inside the lung, so you do not have room to exchange your oxygen. And that's what usually happens. So even in ventilator, and you really push the oxygen, you're hardly going to get to the 80 or 90%. I have, though, a good piece of news. You know, I work with those, and I treat them, and I'm involved with it. I was working this weekend, and I just came back from the hospital. And the good thing is I'm seeing less and less of people going to the hospital with this virus. The admission was last week was 30, today was 2, and this is really great. So hopefully the trend is going down, and I think people are taking care, people not exposing themselves, they're wearing the mask, they're doing the right thing. I was so pleased. I went to 2 hospitals today. I was so happy and pleased that really the number are going down. I still walk through the hospital. You don't see all these stress from the nurses and all these, everybody relaxing a little bit. Some of the units we opened up because we could not put them anywhere else. We're closing those units because we don't need them. So really a good thing. So hopefully we can turn around things a little bit.
How about medication, doctor?
That's a very good question. You know, people call me and they said, look, you know what? I have this now. Hydrochloric wine, you know, the hydroxychloroquine wine. Mahdi probably is familiar with it. And some people not only want to take it, they want to prescribe it to their friend. And I don't know how they get hold of it, but it is in every house and every person. It's amazing. I will go to the pharmacy. I said, just want to see. He said, yeah. I said, we don't have it, you know, but everybody else has it. Look, you know, we learn from our religion in the Quran a risk benefit when God talked about alcohol. And he said there's some benefit and some risk, but the risk way above the benefit, so stay away from it. One can apply this rule to everything in life. And I apply it every day in my medicine. Look, this drug has not been proven to be of any benefit. It's all a theory. So we know the risk of it, and I have stopped it in so many patients because I could see the arrhythmia and the palpitation and the problem they go to. I have to stop it before. So my recommendation, if you have to take it, you have to be in one of 2 situations. Either you're involved in a research because we need some answers, or you are in the hospital and they're giving it to you. Other than that, we try some steroids, some anti-inflammatory, something, you know, the Z-Pack. All of these, unfortunately, have not been shown. There's a new new drug for the viral. They tried it in Chicago. It's called the Remdesivir. It has been used, but now we're trying it again. They seem to have results. You really have to have good study to determine what to do.
Absolutely.
So, you know, when you are at home, you need to be active. You really need to do the right thing. You need to exercise. You need to read the Quran. You need to read books. Develop a new hobbies. Maybe you can paint. Maybe you can, and be social with your friends. Call them. And because otherwise you become anxious, become depression, become lonely, and we have to deal with other things. If I have a little bit more time, I can discuss a little bit quickly about Ramadan. If I don't, I'll leave it for another time.
No, let's go ahead very briefly. We got 2 minutes. Let's go ahead and do that.
You know, a lot of people ask, can I fast? Or should I fast? And my answer, really, we don't have any contraindication, any problem with this virus and fasting that I have seen. You know, some people you have to wait. All of this, really nothing theoretically speaking. So if you are able to fast last year, really should be fasting this year. There's no excuses. Most of the medication are given once a day, or they given are twice a day. And this is a blessing month. You know, we are the guests. We are guests for God. I mean, first we were kicked out of the center. Now we want to kick ourselves out of being guests in God's hand. I mean, that's really bring depression to me. If I want to take all these from me, that will be depress me rather than that. So I look, everybody should ask his doctors, but all the people that tell me, I said, try it, and I adjust their medication. I said, if you cannot, you can stop, but don't assume you cannot and just go on and say, you know, Dr. Ajjour told me. I have responsibility toward God to really face this issue. And I have all the doctors that advise them, they advise them from their conscience. I think if you can, you know, if you can smoke and you can walk and you can do this, you can fast. And look, fasting, one quick thing, fasting improve your blood pressure. It improve your sugar. It make you lose weight. And a recent study suggests that fasting will improve your immunity. And you need this to fight this virus. I want to thank you and thank for allowing me to come to the House of Wisdom through this Zoom. I appreciate that.
It's our pleasure. It's our pleasure. We thank you so much for your time. As always, you've always been there. Every time we ask you, you're there, you're available. We want to thank you so much for everything you do and for your support. Absolutely.
God
and
you do a wonderful job. We all need this. I do ask everybody listening to this to be part of the House of Wisdom. Money is not the only thing we have. They have committees, they have need, they need volunteer, but obviously they need financially to be supportive. And I've been there for 25 years. I know it's going in the right direction. I know it's going all to the community. I know probably more than 95% of the money you put, it just go directly to serve the community. So whoever can help one way or the other, please do that.
Allah bless you, Dr. Ajjour. Really, you are one of the central secrets of success of Islamic House of Wisdom. And your information, absolutely, you know, the hadith says that sumu tasihhu is exactly what you said, the Prophet Muhammad, peace be upon him. Not only that, the Quran, wa an tasumu khayrun lakum. So Allah himself is saying, of course, the same Allah says, وَمَنْ كَانَ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرٍ. If somebody is already sick, that is different situation, whether it's sick with coronavirus. But if somebody doesn't have this sickness, just because, well, you know, if I drink more water, it's good for coronavirus. I mean, if you are at home and you are keeping your social distance and there is nothing going on, there is no excuse for breaking your fast. So thank you for combining religion and reason, for combining your wisdom, your education, and also your faith. And we are very, very proud of leaders like you in our community at the Islamic House of Wisdom from day number one, that you never hesitated your support, your generosity, and your help for House of Wisdom and for anybody in community that you've been. One of the things that you said recently, Dr. Ajjour, that you said that you yourself even were not worried about, this virus. What is really bothers you more is deprivation from Salatul Jum'ah and the fact that we cannot get together on Friday and pray together and see one another. But Alhamdulillah, now with blessing of technology, we can see you, you can see us,
Yes.
and we can get benefit from your wisdom and your information. God bless you and keep you safe and healthy, inshallah.
Thank you,
Imam.
Imam.
Same to
Thank
you.
you. I
Thank you.
appreciate it.
Appreciate it.
And
Thank
we
you.
want to
Dr.
welcome.
Ajjour.
Thank you.
We want to welcome a dear friend to the community and to Islamic House of Wisdom, to me personally, to Imam, to everybody, and that's Sayyid Hamid, Sayyid Hamid Sadr. Good afternoon, sir.
عليكم السلام السلام عليكم الله يعطيكم العافية.
I can barely hear you.
Maybe my volume is down. Is that better?
A little bit better.
Okay.
Just raise your voice a little bit more.
Okay, I will. I appreciate this opportunity. I have always been a very good friend and supporter of the House of Wisdom. Me and my friends, we call House of Wisdom Bayt al-Mustada'afin. And that is because, the people that go there are really people that are humble, and they are very committed.
See, Sayyid, normally Imam says that we're House Mustadafin, and I always argue with him about it. I say, no. We may not have enough dollars, but we're the richest organization in the area because we have people like you, we have people like Dr. Ajjour. We are rich in leadership. We are rich in friends and support. You can't really find it everywhere. Yeah, some organizations may have more money than us, but they don't have better supporters and better leaders than we do. So in a way, the money may be not there, but the other assets is there too, and you're a proof of that. Thank you so much for being with us.
Ajarakumullah. I would like to start with a small prayer for all these people that are out there in the front lines, the doctors, the nurses, the police, the fire, all these public people that are facing all these dangers. I don't know what to call it. This is from God, so I can't call it anything but danger, because God always sends rahmah. Hopefully we will learn from this experience and learn how to live with situations like this. And my heart goes out for the ones that have been passing away, whether it's doctors or nurses. I do see their videos, and they are so heartbreaking. So I am open to any suggestion, question that you might have.
Absolutely. If you would like to share with us a little bit about, the Sadr Foundation is at the forefront, whether at this time or before time. We see the faces of the orphans in Lebanon and other places, and all the work you do. If you like to share with us a little bit about, some of the benefits of people working with you and some of the services you provide, and then we can ask you additional questions as well.
I will start with what we have been doing at this point in time with the coronavirus. We have been trying to help organizations like House of Wisdom with their lunch and breakfast and lunch initiative, which is a beautiful initiative for people that are coming. And I've watched them. I pass by there sometimes, and I see how people are in line, and they are getting help from the House of Wisdom. Another thing that we're doing, we have a joint venture with Access, where we are helping there are 800 families that have signed up with Access with very, very bad status, very bad situations where they have lost jobs or things like that, and they are unable to make ends meet. So we're helping them in support of their what do you call it, of their daily needs, whether it's food or hygiene items. We also have been getting some medical or personal protection equipment, like gloves and hopefully some masks. And a couple or 3 weeks ago, we were at the at Beaumont in Wayne, and we donated some gloves with the help of Councilwoman Susan DeVaja.
Okay.
And we are hoping that we're praying that this episode passes by as soon as possible. With respect to the foundation, I will start with the foundation in Lebanon.
Okay.
Sadr Foundation was established in 1963 when Sayyida Rabab was 17 years old. Imam Musa at the time is a leader who, first of all, leads by example. He always tried, or he's always trying to create exemplary, namudaji projects. And he started with Sit Rabab at the time by starting Bayt al-Fatat, where they were helping empower women that needed the help with teaching them how to sew, and that was the beginnings. Now that kept on going, and it became more involved in the 80s, where Sit Rabab was on her own, and she started the nursing school, and these things were happening, one step at a time. Sorry, my mistake. The nursing school started before that, but the other programs, the nursing school, the elementary school, the orphanage, the clinics, these are basic needs for people in the South, where there were no services. Especially in the Mantaqat al-Sharit al-Hududi, the parts that were liberated from Israel in 2000. There are 8 clinics in those areas that serves 50 to 70,000 people yearly with basic needs, including physical therapy, including eye services, and many other things.
Vision services.
Yeah, and they are basically free because the people in those areas cannot afford it. And the reason that those clinics were created is because in the South, when you want to go to a hospital, from any of the towns to get to the hospital, it might take, 45 minutes to an hour to get there, and it is very hard. So this is how the foundation was helping. And like I said before, these projects were exemplary, were not for profit. They were not to create something that is to make money. It was just to help people for the sake of helping people.
How are they affected by, COVID-19 has affected the economy worldwide. How are they affected now in Lebanon by this?
It is very hard.
Yeah.
But yet, they're out there. They're collecting and delivering food rations, basic needs to people. Again, the clinics are helping. The students are at home. They're at home, and they also what's called cook food and deliver it.
Yeah. Is there anything you can share with us if somebody want to know more about the Sadr Foundation here? And how can we work together as Islamic House of Wisdom and the Sadr Foundation?
Yeah, these we have been trying to help with any means that we can, and we're open. We can provide some funds that we have. We have some still some personal protective equipment, and we are with the help of some companies like Arz Distribution and Greenland Markets. We have received some gloves from them, and we're distributing them.
We thank you, Sayyid Hamid, really for your generous contribution during this food service at the Islamic House of Wisdom, and the fact that you are really, a good example representing Imam Musa Sadr like a great character. You, Sayyid al-Rubab, Dr. Raed, Sayyid Najat, the staff of Sadr Foundation. One of the chapters that your father, Al-Imam al-Mughayyab, Imam Musa Sadr, always used to recite, أَرَأَيْتَ الَّذِي يُكَذِّبُ بِالدِّينِ فَذَلِكَ الَّذِي يَدُعُ الْيَتِيمِ. And he had the best explanation that if you want to see that who is really in denial of deen of Allah,
if you get up and walk right now, they're going to see you. If you're going to leave,
sign of it is that الَّذِي يَدُعُ الْيَتِيمِ, those who reject the orphans. And it's amazing that from the beginning, your father started his non-stop services, both in the area of education and social services, and also focusing on the orphan. And that legacy still on after more than half a century. And is a blessing that you represent Sadr Foundation in our area, and with the light of your leadership, your faith, your good heart, your sincerity, always you are someone that we love. Personally, I love your personality, being such a loving person and a humble person and faithful. I see you in Salatul Jummah, I see you in community functions, and we really appreciate your presence here today and your presence in practice. that you're not just, you speak less and you do a lot. You are more manner of action than expression. So we appreciate both your actions and expressions.
Thank you very much.
Thank you, Imam. Thank you, Imam. Sayyid Hamid, we want to thank you so much for your time. We really appreciate it.
Thank you very much.
Absolutely, absolutely.
God
We're
bless
going to continue. Mahdi, I just like you to remind our listeners and our people who are watching us, our audience, very quickly before we ask Dr. Berry to be with us, just if people want to support, what do they need to do?
Yeah, I mean, there's a link, and I want to thank Sayyid Hamid said, thank you very much for your insight and your time that you spent with us today. We appreciate the support, the continuous support that you offer the Islamic House of Wisdom. Inshallah, Allah accepts it and repays you and your family and your organization, both in this world and the hereafter, inshallah. For those that want to support the Islamic House of Wisdom and their initiatives, there is a link right on the Facebook Live that you're tuning into. Right below, there is a link where you can share with us your information. Or like I said, if you want to hear another voice, it's been some time that we've had human interaction. If you want to hear another voice, just give a phone call at 313-359-1221. Once again, 313-359-1221. Somebody will answer, and all you need to do is just provide your name and your payment information. Take less than 1 minute, and you can support your fellow community member.
Thank you so much, and I would like to welcome Dr. Berry Asseal with us today. Good morning, Doctor.
Good morning. Good afternoon, really. That's okay. I'd like to thank you and thank Imam Elahi and Sister Jennifer and their family and their children, everyone at the Islamic House of Wisdom, for offering us this wonderful opportunity to communicate with each other and to keep Islam alive and healthy.
Thank you so much.
You're very welcome. I kind of like want to say what the Sadr person, Hamid Sadr earlier said. I can also testify that the Islamic House of Wisdom is out there and always willing and ready to feed the needy and the hungry. I've also stopped by and I've seen people come from all over the world. I mean, I want to say from Detroit, from other areas, people that really, really know that the Islamic House of Wisdom is willing to give them. And they stop in and I watch them eat and I communicate with some people, and I know people who are there who volunteer their time. They go there every single Friday. You look at some people while they're eating, you say to yourself, my God, they really are hungry. And then they pick up more food and they take it to their loved ones. And at the same time, you see others who are really, really hurting. They probably don't want to be there, but whatever their fate, happened to be, they happen to be at the Islamic House of Wisdom. So yes, I can testify, like he said, to that. And today, the only topic I'm going to be talking about today is really the act of giving.
Okay.
One of the 5 pillars, and we all know that one of the 5 pillars is one of our obligations to give, and it's our duty as Muslims, if we can meet the necessary criteria to give, then it's our obligation to give. When we think about life, a lot of us know, and we've seen many, many, many who have more than they would ever be able to take or do anything with, like the Prince of Saudi Arabia, Al-Walid bin Talal, or Jeff Bezos, or Warren Buffett, or Bill Gates. None of them. No one's going to take anything with them. And you don't have to be that rich to be willing to give. But if you do have, money from stocks or mutual funds or anything that you've been trading, or, I mean, all that is there, and you know that you're not going to take it all with you. Whether you're wearing a Timex or a Rolex or whatever you're wearing, time is time. I mean, yes, it's nice to have all these nice things, but in the end, we all know that that's a loan, and it's good to pass out what you have while you can and while you're alive. With the COVID-19, a lot of us are home and we're sitting here thinking more and more about the intimate things that go on in our lives and things that we probably would prefer that we would be doing rather than be sitting home. But at the same time, it's giving us the chance to think about people out there. And I've been talking to people from all over the world. I have friends from Africa and other countries, and even the girl in Lebanon had said to me that they are feeding their children sugar water because they can't afford milk. And so I'm sure we have people here, and if you're watching the news, you've seen people in this town and in other towns who are standing out there hoping that someone would give them money. And people don't like to ask for money.
Sure.
People are out there just wondering, you know, I wonder if she knows I can't afford it. And I got a phone call yesterday, and she kind of said things to me, and I'm like, oh, now I know she really needs it. So people don't want to ask, but we know who they are. And I think it would be nice if we were able to reach out. Sometimes you don't have to just reach out with money either. You can reach out with clothing. You can reach out by inviting people over for a meal or taking a meal and putting it at their door. It's not a pretty picture when you see these little kids who are hungry or are wanting something and they can't get it. And it's sad. And so, you know, and then the most important thing, and this is what we realize and people don't really think about it much, is that you're not giving it just to give to them, because in the end, we're all going to be held accountable for what we've done and what we didn't do while we're on this, on the face of the earth. And so we're really doing it for ourselves. And a lot of people too, this is what I really don't like, is a lot of people who are out there giving, they're giving just so that they can say, hey, I gave, you know, make sure you mention my name. Make sure you call my name out loud. Make sure you know that I gave $10,000 or $25,000. Why? You know, God doesn't want us to do that. Even if you pray in private. You don't have to pray and let people know, hey, I want to go pray, or I want to go give $10,000 here. Give it in whatever you give. Rest assured, and this has happened to me many times, rest assured, whenever you give in charity, that what you give, you're going to get back tenfold. That's in the Quran, and I know that for a fact. If I give 10 cents, I find $1. It's always, no, if God gives us back, somehow, some way he pays us back. And again, we're coming into this world with nothing, and we're going to leave it with nothing. So there's a lot of Quranic verses. I can sit here all day and read all the Quranic verses, but that's not my specialty. Imam Elahi will have the whole month of Ramadan to read all his verses, and people will understand exactly why they need to give and why they shouldn't give. There's the other thing too, like some of us loan money out to other people's, and you realize now that they can't pay back, and you give them more time to pay back, and of course you're doing it without interest, but just give it to them. Just let them have it. I mean, consider it charity. The Quran reminds us that we have to be humble, and we have to do whatever we have to do to give the others. And I really think there's one more thing that, like these small little things that I just want to mention, like let's say you're on 94 or 96, and you're at these intersections and you see someone there who's got a sign and standing out there and telling you I need. And I've seen people, like even in my car, they who are with me, and I get mad at them, start yelling at that person. You can't yell at people who are standing up with a sign. You don't know why they're standing up there with a sign. You don't want to give, don't give, but don't yell at them. If you give with a smile. Don't
be judgmental. Yeah, don't be judgmental.
Yeah, don't be judgmental. We can't judge people for something like that. That's not our job. Yeah. And so whoever we're giving, whether we're men or women, God wants us to give. You can give from your work, you can give from your money, you can give from your whatever it is you want to give of yourself to help others, you can go ahead and give it. So a lot of us are, sitting here wondering what's going to happen to other people who can't have it, and then the stimulus checks that they're waiting for just so they can stamp his name on every check. When they do get their checks, if they don't need them, I recommend that you give those checks to someone who does need them, who is asking for the help. And basically, that's all I have to say. And thank you for allowing me to share my thoughts on giving.
Absolutely, absolutely.
Thank you, Mary. You know, you are talking about giving, but really, I always see you as the first person of giving, and generosity is not something that you say. Generosity is something that you do all the time, and you help us in the board of directors of House of Wisdom for a long time, and still we have the legacy, your organization, the way that you used to have all those board minutes together and organize it in such a perfect way. Your interfaith leadership, the conferences that 3-4 conferences that you arranged and have so many of interfaith people involved. God bless you, your husband, and your family for your generosity, and be a good role model in action. You
Oh,
are
thank you, Imam. Thank you, Imam. It's your presence and your encouragement help a lot. It makes a big difference. You're very humble. You are a very, very humble Imam, and it's very easy to work with you. Very easy.
Thank you.
Thank you again. And what we're going to do is, absolutely, what we're going to do is we're going to ask Mahdi to share a little bit more about the services that we provide, and if we have additional letters to read, and how can our viewers can support us. Go ahead, please.
I want to first thank you, Dr. Asseal, for taking the time and sharing with us the importance of giving. You know, a lot of the times through experience, we see that as soon as we give, sometimes by the end of the day, we receive our reward. You know, and it could be so a miracle sometimes. You know, you look at it like, you know, I just gave something and I received, you know, 2-3 times, you know, back, and it's one of those like subhanallah moments.
Yes.
So thank you for your time and the investment that you made, not only with the board, but through your contributions as well. We appreciate it at the Islamic House of Wisdom. I want to say assalamu alaikum for everybody who's joining us. I know that, you know, we have a pretty stacked program. We're blessed to have many of the panelists join us, take time out of their day to join us and share with us some of their insight and their value in terms of their from their respective fields, and how the current current climate has affected you know, their work and whatnot. Now, I was talking to a friend of mine about when he thinks this COVID-19 pandemic will blow over. And he said the question isn't whether we'll be able to leave our houses soon, rather it's will we be able to fit through the door, you know, after the things that we've been eating. You know, it could affect you know, our shape. So on that note, I want to remind everybody that the Youth of Wisdom is encouraging everybody to do exercise, record the distance that you covered, and send us an update through our Instagram page, Youth of Wisdom, so that we can work towards our goal of a complete 1,400 miles to recognize the Imam of our time, the 12th Imam. The Holy Prophet Mohammad, sallallahu alaihi wasallam, he says something very powerful. He says that the blood, right, and education of the people are more sacred than the Holy Kaaba. And if you haven't taught at least one person at the end of the day, then you have left this religion of Islam. An obligation that we have is to get our youth more involved. Statistics show that 35% of high school graduates never read another book in their lives. And it really goes to show the importance of education and what the Islamic House of Wisdom is doing in terms of educational opportunities. Number one, with our Hausa Seminary Islamic Studies. One thing that this pandemic has taught everybody is, you know, a lot of times I go to work, I work in the pharmacy, and, you know, I have American coworkers, and some of the things that I hear them say is, you know, we used to have football on Monday, on Thursday, sometimes on Saturday and Sunday. We used to have the basketball games being televised on TV throughout the week. We don't have that anymore. So we're going crazy. We're going insane as to what we could do to occupy our time. And one thing that this faith really establishes is a sense of purpose. It's a sense of belonging, that, look, You have so much extra time. You can invest it in getting to know yourself better, finding your purpose in life, instead of distracting ourselves with these televised games on a constant basis. Maybe one of the opportunities that have been provided to us is, look, there's the cancellation of all this entertainment so that we have more time to focus on ourselves, more time to ask ourselves the critical questions of what is my purpose in this life? Who created me? And where am I going after my life here is up? These are critical questions that we need to ask ourselves. And that is exactly what the Islamic House of Wisdom is doing through their Islamic seminary, Islamic studies courses, really to show people, look, it's not all about entertainment. We have this opportunity. The holy month of Ramadan is coming. We have a chance to really incorporate the saying of the Holy Prophet, who says 1 hour of reflection is worth more than 70 years of worship. Why? Because if you truly reflect on your purpose and your life, that is far more valuable than worshiping, because the things that will result from your reflection will be just as valuable, if not much more, to those that are in need. There are ladies programs continuing weekly in both English and Arabic online. There are weekly high school youth programs that continue online every single Friday, a unique opportunity for the youth to connect and learn more about their Islamic faith, to build that sense of purpose, understanding that this life isn't just, the current moment, that we have much more to think about, much more to reflect upon. And the Ramadan programs, which will be beginning soon, we have an awakening month planned for everyone. We will touch on key topics needed. Initially when we started this broadcast, we were joined by Dr. Wassim, or Hajj Wassim, and his crew talking about drugs. We're hoping to bring him back and many other prominent speakers in our community to touch base on some of the key topics throughout the holy month of our Ramadan. Please follow our social media pages to keep to be updated with those programs. Imam Elahi himself has been offering religious lectures almost daily through the online networks and engaging Friday sermons. A lot of the time as a public speaker, it can be a little bit maybe discouraging, not feeling the presence of the crowd in front of you, seeing some of the reactions, really feeling like we're under one roof. It could be a little bit difficult speaking through a webcam, not seeing some of the beautiful faces that usually attend the Friday prayer. But Imam Elahi has continued his Friday sermons every single week. And since people for Friday prayer, they would say, I'm at work, I can't find the time to leave work, and although that's understandable, many of us now have the opportunity to tune into this Friday prayer on a weekly basis that Imam Elahi has been so kind enough to continue, even though this pandemic has taken us by storm. Some of the letters that I want to now touch base on, because it's very important. You hear it from me, you can hear it from Hajj Khalil, you can hear it from the board members of the Islamic House of Wisdom, but to really put into perspective the influence and the value of the Islamic House of Wisdom, we have received letters from people throughout the community. One of them is Dr. Mary, who wrote us a beautiful 25th anniversary letter. She says, I would like to take this opportunity to congratulate the Islamic House of Wisdom, Imam Elahi, and his board members on 25 years of service to the Dearborn Heights community and its vicinity. Imam Elahi has touched the lives of thousands of people near and far, where God has destined him to reach, and to clarify the important message of brotherhood and unity among all believers. If he is on a mission, he will never stop until he is done. He works with board members as a team and participates in all activities and programs. He dedicated a large part of his work to interfaith while respecting the dignity and humanity of all. He welcomes controversy and disagreement, but he speaks with one voice while maintaining a high level of professionalism and understanding. He goes the extra mile to live by his mission to promote faith, education, justice, compassion, outreach, action, and unity under the principles and values of Islam. Thank you, Dr. Mary, for your kind words. Another letter that was received was, over the past 25 years, Islamic House of Wisdom has become an indispensable part of our society's outreach, not just within Muslim communities, but also in the field of bringing and building bridges with non-Muslims at large. Under the highly charged current circumstances, this is the most critical activity for which Imam Elahi has to be commended. And once again, the credit doesn't only go to Imam, but it also goes to the board members, to the staff of the Islamic House of Wisdom, to those that have supported this institution over the past 25 years. We thank you for that continuous support. And now on this topic of education, I think it'd only be right if I share one of the letters that was sent by Hajj Nawal Hamadi. For those of you who do not know, she has multiple schools throughout the Wayne County area, educating the youth in our community, making sure that they acquire a high school diploma at the end of at the age of 18 years old. You know, that's a big accomplishment. Many times people families just migrate to this nation, and education may have not been available in those other countries, but Hajj Nawal Hamadi has really been a beacon of this community, someone who has emphasized on the importance of education. And she writes, first, Assalamu alaikum. First, hope this reaches you and your family in the best of health and safety. Congratulations to you and the Islamic House of Wisdom, its board of trustees, staff, and families on your 25th anniversary. This 25th anniversary marks a year of accomplishment, a year of pride, and a year that no one would ever forget. The world is spinning around the COVID-19 pandemic, a year of reflections and resetting our priorities where faith, health, humanity, and education are top priorities. It has put power, strength, economic control, injustice, weapons, and heavy machinery to a shame. The smallest virus that cannot even be seen has caused the world crisis and made everyone and every country sort of powerless, where all of a sudden everyone is equal, regardless of their strength, age, economic status, or even health. Everyone is susceptible. We know that no matter what we do, and watching over us. Everyone is reaching out to God and to doctors for solutions. Many may not be reminded that we need the house of prayers such as the Islamic House of Wisdom to keep the generations focused on their priorities and to redirect them to the basics in life. I commend the Islamic House of Wisdom for its continued outreach and its mission and vision as led by Imam Elahi to spread the word of truth, justice, and humanity, and to continue in its outreach to the interfaith to bring about better mutual understandings about Islam and Muslims, to promote peace and harmony between people of different faiths. Please support the Islamic House of Wisdom and its mission to reinforce and spread the word of God, Islamic faith, and education. Wishing the Islamic House of Wisdom and the entire community ongoing success, inshallah, with safety and best of health always. Thank you, Hajj Nawal Hamadi, for your heartfelt letter. We pray for you and your family for safety and health as well. I want to now communicate some of the individuals who have supported and donated and recognize them. First is the TSB Insurance Agency, the AJ Khalil Pars Ice Cream, FBO, the Latifa Berry Rev Trust, Albert's Furniture and Appliances and Center Incorporated. Thank you so much for your continuous support. You know, even in these trying times, we continue our programs. We take a look at our youth programs every Thursday. Our Arabic programs and Girl Scouts have continued virtually with your donation. And here is, for those who have stuck with us throughout this broadcast, with your donation of $25 a month, we will send you a Youth of Wisdom t-shirt with logo on it. I absolutely love this t-shirt. I wear it myself. I've heard compliments. Some say it resembles the works of Michelangelo even. So do not miss out on this t-shirt. If you donate, if you become a sustaining member, $25 a month, $50 a month, $100 a month, whatever you can do, we welcome that. But this is while supplies last, and we have limited quantity. So get yours today and make sure you mention it when you're making the donation. Like I said, there's a link below, or if you want, give us a phone call, 313-359-1221. by becoming a member. You're not just helping the masjid, but also everyone around you and your fellow community members. Please share that information. There's a link right below the Facebook Live. Also, the phone number, once again, 313-359-1221. Less than 1 minute, you can share with us your name and your payment information.
Thank you, Mahdi. I really appreciate it. I appreciate all the information that you're providing, and specifically about the services that Islamic Wisdom is providing right now during this crisis to the community. And as you said, you know, this is Islamic Wisdom is not closed; it's still open and it's still providing very important services to this community. I'd like to welcome one of the distinguished leaders in our community, and that's Hammoud. Thank you so much for being with us, taking the time to be with us. You know, Abed has served the community in many different ways, as an attorney, as an assistant prosecuting attorney, as an assistant to United States prosecuting attorney as well. And now in the, if I'm not mistaken, you are in the private sector, correct?
Yes, I have my own law firm, and thank you for having me.
Absolutely.
And I really want to thank Dar al-Hikmah for everything you're doing for the community, but also when I congratulate you on this program. I know how much effort it takes to put something like this together and under these conditions. So really kudos, I'm very impressed. Not surprised, but very impressed. Thank you for doing this.
Thank you. Thank you so much. We really thank you for being with us. And we're so proud of individuals like you in our community because of what you accomplished and what you've done and how you serve this community. It is the pleasure, it's an honor to have you with us. The issue you want to focus on here is the domestic violence. And, you know, how much of a problem is that in our community, and what can we do about it, and what kind of help can we provide?
I know domestic violence is an issue that does exist in our community to the same extent, I believe, at other communities. Is not more or less necessarily. It could be less in certain instances because of the nature of our culture and close family knit that we usually have that provides support and help in situations that need support and help to avoid domestic violence. I don't have specific numbers on or statistics on how it is in our community compared to others. All I know is from my work as a prosecutor in Wayne County, always noticed we had our share of cases that was reflective of our size as a community in Wayne County, for example. So our numbers, not so high when we put ourselves in the entire Wayne County, and the same thing, domestic violence. Domestic violence is a phenomenon that transcends cultures and boundaries and national origin ethnicities. It's unfortunately everywhere. And like I said, it's kind of the same percentage in a way. Some community may have it more than others. Typically, one of the things I've seen in my experience, what exacerbates domestic violence is alcohol. When there's a high consumption of alcohol and sometimes drugs, but mostly alcohol, I remember the cases I've handled in Wayne County, most of the time was alcohol. I never had somebody coming in necessarily because they were doing drugs as much as they were doing alcohol. So alcohol exacerbates the problem because people usually have tensions in their household. Unfortunately, it's very difficult whenever people live together, even without the crisis, that there be tensions. And this happens in every single one of our households. We have tensions with our kids, tensions with our wives, with our companions, with anything, and our family members. The problem is domestic violence is when we try to resolve these tensions in a violent way. That's illegal and immoral and not allowed under any code that I'm familiar with. And when there's alcohol or some other issues, medical issues, mental issues, sometimes it's easier to resort to violence to solve that problem, which of course does not solve it. So I hope because of that, the consumption of alcohol typically is less in our Muslim community. I wouldn't say for sure it's less, but it's supposed to be less. So that we should have less incidents, because that's one of the major factors. Now, in this day and age, in the called Corona era, there's an increase in domestic violence around the world. Actually, I was reading articles, even in Lebanon, they were talking there's an increase. Why? Because people sit at home together. One of the ways people avoid domestic violence, people avoid getting violent, sometimes they just walk away. You know, you can fight with your son. I mean, those also adult kids, you know, who are our age, our height and our weight, and they look at you, your son looks at you, and then you don't feel anymore you can yell at your son or slap him like you did if he goes overboard when he was, let's say, 10, the same way. Slap him, you know, push him a little bit, which is also, that could be domestic violence, depends how much you do of that. But that being said, sometimes you just walk away. Your son walks away from you. Your wife, the same thing. Your husband. So these things, because people are confined together, tension is going to rise no matter what. And that tension could result in domestic violence. So that's something we need to avoid. We need to be careful. We need to walk to a different room, try to call somebody on the phone, talk to a family member on video on the phone, because it's so important when you talk to other people, when there's domestic violence going on, you can put things in perspective when you talk to other people, when you consult with other people, when you think that your husband or your wife doing things that are unbearable, that you can't take it anymore, you're about to explode, pick up the phone and call a family member, call a good friend, close friend, tell them what's going on, because sometimes it's not worth it. It's just about cooling off. If people could cool off, a lot of this could be avoided, because like I said, we all have tempers, we all can be under pressure, we all can get tense. The idea is to cool off and to avoid the physical contact. The other thing is about domestic violence, I like to say, because I've heard some people sometimes say, I don't beat her up, so I'm not committing domestic violence. Any touching that's unwelcome is domestic violence under the law. Any pushing, any shoving. So somebody says, oh, I just pushed her. I used to see this in my cases. The defendant comes and says, what do you mean I just pushed her on the bed? First of all, it's illegal to do it. Second of all, this is how it starts. First is a pushing, a shoving, a slapping, a punching, and then before you know it, there's weapons, there's things, and it ends up with murder. In fact, one more thing I say before you ask me other questions. One time I remember, I never forget it, 98 or something years ago, I went to a seminar entitled Homicide Prevention Seminar. It was about domestic violence. They called homicide prevention because a lot of domestic violence can end in homicide, as we know in our own community recently. So that stuff is very dangerous, can escalate, we should avoid it.
Absolutely. For those who are listening and watching us, could you define what domestic violence is? Because I think some people think the domestic violence is when you commit a crime, which is not really, like when you kill somebody.
No, domestic violence is defined as a crime, of course. There are multiple levels. The most basic one is you take any typical assault and battery, that any time somebody hits somebody, any way, shape, or manner, any unwelcome touching, when you have any assault that happens between members of the same household, the state of Michigan defines this in a statute. There are multiple ways to become domestic violence as opposed to regular assault. One of them is people are married, spouse or former spouse, have a child in common, have a dating relationship together. This was an addition a few years ago. And then, or a resident of the same household, and they have an intimate relationship. So these are some of the ways to define it. But essentially, domestic violence is any assault and battery on somebody who lives with you in the house. Again, typically it's between partners. Most prosecutors do not charge when it's brother and sister or something like that, but it's assault on a spouse or on a companion in the household. And that's a crime. That's a serious crime, and the state statute does punish it. It's a misdemeanor the first time. It becomes a higher misdemeanor the second time they track them, and it becomes a felony on the third time. So any assault is domestic violence. Doesn't have to end in killing. Now, there are also other felonies that are domestic related. Let's say somebody takes a knife and stabs his wife or threatens her with a knife. That's a felony under the statute, felonies assault, but there's also felony domestic violence is called. So let's say that case goes to Wayne County. Felonies assault, typically, it's a 4-year felony. The file will be stamped domestic violence and handled by that unit, because that case, that stabbing happened between the husband and wife.
Absolutely. So depending on the severity, on what case it is, then the punishment
varies. Yeah, but even the most basic one is a misdemeanor that you could go to jail for. Another thing people have to be aware of, any domestic violence call by the police officer when they show up to a house, they have to take somebody in for 20 hours at first, which is called the cooling off period. The statute requires that. So typically they can take the person who's more agitated, the person who looks like more likely to hurt the other one, even if the other one started it. The cops are going to show up to the scene. They're going to make a decision on the spot to see who they take in. And even if the charge is no charge result, somebody's going to jail for 20 hours. Yeah. And one thing I like to advise people, do not take it lightly or not call the officers because our culture says this, not this, not that. People have to deal with their problems seriously. No need to call the cops and every time you have an argument, but when there's physical violence involved, do not wait on it, because it does escalate and people get hurt. And when you get hurt first time, don't say it's not going to do it again, because studies have shown, my experience has shown that when somebody hits a woman, especially men hitting a woman, because it works both ways too. I've had cases where women hit men. But most typical domestic violence, a man hitting a woman. When a man hits a woman the first time and gets away with it, he is going to do it again. Yeah, he is going to do it again. She should not say, I know this time he gave me a black eye and but wallah, I love him, and you know, I'm gonna go, you know, I pray to God, he's not gonna do it again. No, if he starts hurting you physically, you should call the cops.
Absolutely. And you mentioned this, you know, most people, when they think of domestic violence, it's men against women, but it actually, cases can be both ways.
Absolutely. I handled more cases than I thought I would handle when I was a prosecutor, where women were the assaulting party. And again, the alcohol was the biggest factor.
Yeah.
Most of the ones were women. And, you know, believe it or not, we used to see a spike of those cases in holidays, around holidays, like mainstream holidays. Let's say Thanksgiving evening, Christmas, we get more domestic violence cases.
Is it because people get together, or just because
they get together and alcohol, both the combination? But get together also, like that's why during Corona days and when people are confined at home, you're going to see a spike domestic violence cases. I don't know now if it did happen. I'm not working in the prosecutor's office anymore, but I can expect it. I've seen some articles about it.
What's the span of time, like when people report, investigate, and then being prosecuted? What are we talking about, like several months?
No, it depends on the case. If it's a typical misdemeanor, it's going to be handled at the city level, even if it's Wayne County that charges the case. So a typical misdemeanor domestic violence, somebody gets picked up the night of the fight, let's say, they're fighting, the police come, they take him into custody. He will get charged the next morning or at the most within a day or two. And then his case moves to a system. And a misdemeanor case in Wayne County, most cities, depends on the city, is going to move in within a couple of months at the most. Then there'll be sentencing, then he'll be on probation if it's the first time. And there are programs and counseling programs, and the first timers benefit from a statute called MCL 769.4A. That statute provides for programs and provides for the expungement, automatic expungement for that crime. So somebody who, you know, went through an unusual stress, let's say Corona times, and then get unusual stress and hit his wife and get taken in. She wasn't injured badly, but he hit her still, and she called the police, and they charged him with a misdemeanor domestic violence. That person can benefit, if he has no other record, from that program. It's called, we call 769.4A. It's kind of an under advisement program. He gets some counseling, some probation, pays some fines, some community service, and then after this, the case is dismissed automatically after this is over. So first timers, they get a break because they understand this can happen in any house.
Yeah.
But it has to be the one time only.
Absolutely. And that was going to be my second question, which is...
And no serious injury.
Where do people get help?
People get help from social service organizations. I'm not aware exactly what programs are out there right now, to confess to you. The last few years I worked as a federal prosecutor, so my cases were more high-end fraud cases, and I worked more financial cases. But I know from, you know, talking to friends and colleagues and other lawyers that there are a lot of social service organizations provide these programs. In our community, there's several of them. I think that a base club may have a new program like this. I know that Access have a domestic violence program. Some of the mosques have. I don't know if Islamic House of Wisdom has. But even if they don't, you should talk to your, you know, your imam, to your mosque. You know, especially the first time something is not escalating, not, you know, bad. And I certainly hope, and I know this is not the case, al-hikmah, but I've heard sometimes people going to imams. Unfortunately, I'm not gonna name anybody, and she gets beat up badly, and they still convince her to stay there. It's okay. He's your husband. This is Islam. This is not Islam. Islam does not condone violence. And if you go to an imam or a mosque that tell you it's okay, he beat you up, go back home to your kids. No, that's not okay. They need to get help for the husband. They need to talk to the husband. They need to get help for the aggressor party. You should not say it's okay, he hit you, it's Islam. No. When it goes to a mosque, they should be advised that they seek help from the social service organization or other things, that people who are qualified to help them.
Absolutely. You know, you mentioned at the federal level you work with the financial aspects. What can you share with our audience?
I mean, I worked on fraud cases, so I just tell them, be careful, don't commit fraud. But I also say that, you know, a lot of things people do sometimes and take them lightly, because people think the word crime applies only to a guy walking down the street having a gun and selling drugs. Everything that's the law defines as a crime is a crime. So if somebody cheats on their taxes, a pharmacist who sells medicine, quote unquote, to dead people, somebody who bills Medicare when they should not bill Medicare, a store owner who cheats on things they sell to people, anything that's illegal, it's a crime, and they can get caught. And penalties can be very severe, and it's very embarrassing. And nothing worth any of this. No financial gain is worth, you know, like food stamps. We still see a lot of food stamps. Before I left the government, I saw several cases of food stamps within our community. People still cheat on food stamps. I'm not talking about that people go to the store and lie. I'm talking about the store owners. People keep getting caught, and the store owners keep doing it, and they know it's the government after them. They keep doing it, and they're surprised always. They tell you, oh, you know, I sold somebody I know. There is not such thing as somebody, you don't know who's undercover, who's buying stuff from you working for the government. Those cases I was astonished when I saw how prevalent these cases are still going on in our community, because everybody knows the government's watching. What do you think they don't know? And so people have to be careful. That stuff is serious. That's a crime. That's aib, that's haram, that's illegal, and you go to jail for it.
Absolutely.
Thank you, Hajj. Sorry, Hajj. You have another question? Go ahead.
Yeah, I was just going to say, if there's anything I haven't asked that would be a benefit to our audience.
Imam Elahi has something to say.
Okay. I just want to thank you, Hajj Abed. Courageous character. You always speak up and speak out, and a good role model. And you are absolutely right. I mean, if you want to have peace in the community, we need to have peace in the family. So fix the family, fix the society, and hopefully now the month of Ramadan is Shahr al-Salam, it's a month of peace. And I hope that, we as families follow the Quranic example, لِتَسْكُنُوا إِلَيْهَا وَجَعَلَ بَيْنَكُمْ مَوَدَّةً وَرَحْمَةً. So the family is supposed to be a source of security, safety, and peace for the members, and the first school of peace and respect. Absolutely, very, very valuable information that always you do, valuable information.
Thank you, Maulana. Thank you for your leadership. We learn a lot from you, and then what you do with Al-Hikmah, you and the board and the members and the volunteers, really appreciate, especially in those difficult times. And I'm a big fan, of course, and I really truly believe in your mission and the way you approach things. You're always innovating, and that's very important, because Islam is about innovation, about modernization, about being open. And you've shown a lot, the openness, especially to other religions and to other people. And that's why whenever people ask me questions about religion, I come to you and I send them to you, as you know. And it's something we're very proud of, and we're strong supporters of Al-Hikmah, and I hope everybody understands that and supports you.
Hamid, I had one question. I'm not sure if what are potential warning signs that a spouse is potentially going to lead towards violence? Warning signs that maybe they show that you might want to take into consideration.
It's escalation. It's things start rising, and then there'll be some signs of violence. Violence can be directed directly at the person. They start breaking things. Sometimes they start pushing. Sometimes pushing and shoving is a sign. Things like this. Of course, again, if there's alcohol, take it very seriously, because that can cause. Again, I don't avoid the subject of alcohol. I don't presume because we're Muslim there's no alcohol in homes in our families. There could be, and so if there's alcohol, they should be really careful, because that's one of the biggest reasons I saw for domestic violence, because people lose their temper, they become a lot more aggressive. It makes people more aggressive, alcohol. And the signs usually is escalation. Don't take lightly the first time. He pushes you the first time, shoves you. It escalates. It's always escalates. It's progressive. Rarely would we have the first instance of the murder. Rarely. It does happen, but rarely. Usually it's escalation. People say nothing, and then that's what escalates. So there are signs.
One more question, based off of your experience in this field. Do abusers change?
They could change with counseling, change your situation. Yes, there is hope. Abusers could be with right counseling, with being faced. I know somebody who's distant relation to my family. He was a big abuser, and then he wasn't. And I know it's gonna sound trite because I'm on a Islamic website show, but he found Islam all of a sudden. He had some other issues. He found Islam, and he was Muslim by birth, but he wasn't really Muslim. And then he became a lot nicer to his wife, to everybody around him, and no violence whatsoever after this. So sometimes counseling, change of situation. A lot of times it's also stress, financial stress, emotional stress. Kids can cause a lot of yelling in the household. Any one of us who raised kids will know that most of the arguments in the household, if there are no other reasons, maybe 80% the kids. So kids can mount the tension. So the key is not to let the tension mount to a level where it gets violent, gets physical. We all have this temper. I have a temper, but I know there's a red line in my head. And no matter how much somebody makes me angry, I'm not gonna touch them in the house.
So the economy has an effect on domestic violence.
Absolutely. Economy raises domestic violence incidents. Absolutely. Stress about the money raises domestic violence incidents. Absolutely.
And I have a question from Sister Inaya from Bail actually network.
Yes.
She's airing this program through her network as well. She just texted me a message to ask you. She is saying, how about abusive children toward their parents? Because when
Yes.
we talk about, and we had some very tragic incidents recently.
Yes,
so
of course.
that's a good question.
I mean, if a child is just abusive just because temper, they don't have any medical condition. Because my understanding, the last incident, there was some medical condition which should have been dealt with. And if there's no medical condition, just a child being a rebel, we have to try to discipline like a parent does discipline, you know, take away the things you can take away, depends on the age they're in. But they get a certain age, you can call the police on them. Don't take it lightly. A kid should not, I mean, to me, it's, especially when you talk as Muslims, I mean, Al-Ahl bil-Islam is such a big deal, such a red line you can't cross. I mean, Ya Allah wa walidain. I mean, this is, God put them right next to him. I mean, how much more can you do? That's something we don't joke about. لا تقل لهما أف. I mean, I'm not going to start citing Quran in front of an imam, but this is stuff that's a no-brainer. But at the same time, if it happens, family should not take it lightly, should try to get, you know, seek help from other family members. If not, just call the police on them, because those kids will go too far. Don't cut them slack. Another thing is parents sometimes forget. Some of these kids, I've seen them, I heard about them abuse their parents. They still live with their parents. They need their parents for money. Don't give them what they want. Don't give them that car, that, you know, that the money they want, the bank account, the clothes, and then take abuse from them. Just don't do that, because they get more bold.
Thank you. Thank you.
Thank you.
Thank you so much. We really appreciate your time.
Thank you all. Thank you.
To be with us, and may God bless you. Thank you.
Thank you. Thank you all. Bye.
And we're going to return to Mahdi to share with us more information about services at House of Wisdom and how our audience can help.
Thank you for all of you who are just joining us. Assalamu alaikum. On behalf of the Islamic House of Wisdom, we are praying for the health and safety of you and your loved ones. You are in our thoughts. Amir al-Mu'mineen, Imam Ali alayhi salam, says something beautiful. You know, now that we're approaching the holy month of Ramadan, one of the key things to take into consideration is the reminder of our first Imam, Amir al-Mu'mineen. He says that faith is confessing with your tongue, believing in your heart, and acting with your hand. And if we think about it, it's set up like a ladder. Our confession with our tongue comes when we recite our shahada. Then with reflection and contemplation comes true belief in your heart. But Imam Sadr says that the proof of belief is with action. Regardless of what the situation is, no matter the climate or obstacle, the Islamic House of Wisdom has been there like an unmovable mountain, adjusting to the needs of our community. The Holy Prophet ﷺ says, a mu'min is like a mountain which can't even be moved even by natural disaster. Regardless of what disaster we're going through, this Islamic House of Wisdom has adapted, has continued its services, and will continue to do so for as long as it has to. Please support. There is a link below the Facebook Live. There is a phone number that you can call, 313-359-1221. Once again, 313-359-1221. Share with us your name and your payment information so that you can continue this journey of helping the Islamic House of Wisdom that has been a beacon of this community for the past 25 years, continuously supporting, no matter what the climate was, no matter what the situation is. The Islamic House of Wisdom has adapted and is one of the first responders to tragedy and disaster. I want to touch base on some of the counseling and the teletherapy that has been going on. You know, we've had to shift to a more virtual type of situation. The Islamic House of Wisdom continues to provide individual and marriage counseling, divorce mediation. Although this pandemic has maybe opened up an opportunity for spouses to get to know one another. I was just looking out the window and I seen a man wearing a shirt says that I don't need to know how to use Google. My wife knows everything. So it opens up an opportunity for families to get to know one another. But nonetheless, the Islamic House of Wisdom is providing marriage counseling, divorce mediation, and you know, even from the comfort of from your own home, to the use of phone calls and face-to-face online meetings. If you or anyone is in need of support, feel free to call our office or connect with Imam Elahi daily. Doesn't matter what time of the day. I know it may seem like Imam goes to sleep, but believe me, I don't think that he goes to sleep at all. Sometimes I get messages from him at 4 o'clock in the morning, and then he gets upset when I respond at 10 o'clock. And he's like, why didn't you respond at 4 o'clock in the morning? I'm like, you 4 o'clock in the morning? Who's awake at 4 o'clock in the morning, Dad? But nonetheless, the resources are available. You can contact us for any help. Parents who are under stress, I know that you love your children, but never did you think that you're going to be exposed to them every single day, every single hour of the day. It could be a little bit tough with school not being there covering that void. Due to the work, college, family life, we seek to provide families with all of the support that is needed at this time, whether encouraging a healthy home environment through our educational programs, online counseling meetings, in order to engage the family through our interactive programs. If you are in need, I want to say this again, if you are in need of any help in finding a medical counselor who can provide mental health assistance, and I know that Dr. Shady is going to be joining us later on to touch base on mental health. We are ready to point you in the right direction. This is a trying time for all of us, and we need to take care of all within our reach. Now it's time for me to share some of the letters. Hajj Khalil, Imam Elahi, I can sit here and talk to you about all the programs and the great things that this House of Wisdom has accomplished, but sometimes it's best to hear from people in our community. From Hajj Najah Bazi, congratulations to the Islamic House of Wisdom for 25 years of service to their congregation, community, and interfaith dialogue. Where there is peace, there is prosperity. Thank you, Hajj Najah Bazi. From Dr. Hadim Naim, Islamic House of Wisdom is a pillar of not only tolerance and diversity, but of understanding between people from different walks of life. It is an honor to be connected to the Elahi family and the Islamic House of Wisdom community, who embody a better and safer world we can live in with eternal peace. From Dr. Michael Ross, from our interfaith community, he says, as we celebrate the 25th anniversary moment, I think it's very important. He says, as we celebrate. The Islamic House of Wisdom has created a home-like environment where people in interfaith feel like the Islamic House of Wisdom, it's we. It's not you. It's not the Islamic House of Wisdom. It's we, the Islamic House of Wisdom. That's the type of relationship that the Islamic House of Wisdom has built, that Dr. Michael Ross says, as we celebrate this 25th anniversary moment, Imam and Mrs. Elahi, brothers and sisters, I thank God for blessing me for nearly half this quarter century to be a part of life here at Islamic House of Wisdom. I rejoice how warmly you have welcomed me to share together in a mission to heal the grievous wound that divides human life, male and female, and embrace God's gift to us of his first institution, marriage. I pray that 2020 will see the family of Abraham unite in joy. Thank you to Hajj Najah Bazi, to Dr. Halim Naim, to Dr. Michael Ross for your thoughtful comments. I want to now take the time to recognize some of the donors that have supported us thus far. Brother Ahmed Nasser, Haji Nawal Hamadi, Sister Fatima Karamali, Haji Ja'far Khalil, Dr. Ali Al-Hashimi, Brother Syed Naqvi. Thank you all, and thanks for everybody else who donated thus far. I know that I mentioned your names earlier. We pray for you and your loved ones. Look, we know you miss the masjid. You miss walking inside and being greeted by friends. Maybe you came in for Girl Scouts. Maybe you came in for Dua Kumail or Friday prayers. Maybe you came in for the daily Noon Jama'ah prayers, or even the Saturday or Sunday school. Whatever the reason, you came to this masjid, and we know you miss it. Help keep the doors and programs going now and after this ugly coronavirus by making a donation to the Islamic House of Wisdom. Please, I urge you to use the link below the Facebook Live or call us at 313-359-1221. Give us your name and your payment information. It'll take less than 1 moment. We appreciate it.
Thank you, Mahdi. I just can't stress the importance of the support. You know, we all have different ways of helping. Some of us are able to be there and work. Some of us are not, but you can still help. And, you know, it is And we grappled with this issue when we start talking, you know, when Imam was mentioning to us, what are we going to do? You know, we still have, we have expenses, the place is still open, and we were supposed to have a fundraiser. What are we going to do? I mean, and the last thing we wanted to do was, you know, ask people for money. And I wish there was a different way to do that, to really garner and provide and get that support so we can continue paying for the services that we have. Unfortunately, right now, there isn't, and we understand what everybody is going through, and it's the idea of sharing and the idea of supporting each other and providing all of these services to the people who really need it. Thanks again, Mahdi. I really appreciate it. We're gonna continue with our program today, and with us, Dr. Mohammad Dughayli. Good afternoon, Doctor.
Yeah, good afternoon to you and Imam Elahi. Thank you for this opportunity.
Absolutely. Thank you so much for being with us. You know, no one really feels this crisis more than you in the medical community. You know, you see it, you deal with it, you're on the forefront of this, and we bless, may God bless you, and we thank you for all your service, for everything you do. If you want to give an update, you know, where are we in the medics of this crisis?
Actually, we don't have a real answer to this, because this is still ongoing problem, and more and more cases every day are being seen. So we have to wait more time until we can tell exactly where we are going in this crisis. As a start, first of all, I would like to thank Imam Elahi and the House of Wisdom, the Islamic House of Wisdom, for everything you do in the community, especially in this hard time that everybody is facing. And actually, what I would like to talk about the impact. As I said, that we don't know exactly where we are going with this crisis. Is it going to end soon? Do we have so many things are going on, and we don't have a real answer exactly to what's going on. I think the situation is going to go for a few months from now. But what is more important, as we see every day among patients and their families, as well as among our own families and people who we know, that the COVID-19 crisis has a great impact, not only on the physical health, but it has also an impact on the mental health of well-being. And this is what I'm going to stress today, a brief about the impact on the physical health and the mental health.
Okay.
So I would like to start, first of all, that this disease is so crucial, and because of the social distancing and everybody is being quarantined at home, created a lot of stress on the each one of us. And one of the common consequences, so there are early consequences that we can see, and there are late consequences that are going to evolve down the road. But what we are morally concerned about the early consequences of this impact of the disease. And as we can see that the stress and fear is one of the early consequences of the disease. Fear from having the disease, and fear from the future. And there are so many things about what fear can create and what anxiety can create. So there would be so many changes in the daily habits that we do every day, from stress, from lack of concentration on, usually you will have lack of concentration, you are not able to concentrate on what you do every day, and you will have also lack of sleep. And at the same time, as you know, most of the people now, they are staying home, they will have change in their daily habit. And what they do all day, they will sit, watch the TV, they eat, so they are subject of eating too much, and they will have, this would have an impact. So overeating will have an impact on the health of the individuals on the long run. At the same time, you have worsening of the chronic condition. If people in the family, they have underlying chronic conditions like heart disease or lung disease, these things will aggravate during this crisis. As well, it has a great impact on the mental health, especially if some people in the family, they have some mental issues. So these mental issues will aggravate during this crisis too. What has been noticed also from researchers that staying at home, especially among the group of people who use alcohol and tobacco, there is increased alcohol consumption and tobacco consumption, as well as increased drug abuse during these circumstances. So what is more important that the fear and the anxiety will create a social stigma. And this is what I'm going to stress today in my talk, that the fear will create a social stigma toward the people who associate the disease, not only toward the people who associate the disease, but only about other categories. As we know, early in the phase when the COVID-19 started, every family, we have some travelers abroad and they came from abroad, so they suffer from this social stigma too. And there's another group of people who suffer from this social stigma are those who are on the front line. So the emergency responders and the healthcare co-workers, they suffer a lot from the social stigma. So it is an obligation for every one of us to stop this social stigma. And how we can stop this social stigma? Why? Because these people, as they mentioned, the three categories, they are subject to social avoidance. So everybody, they start to avoid those who travel from outside, or they avoid those who are on the front line, so they are afraid from catching the disease from them. So they are subject to the social avoidance. And as a consequences of this, it will create a great impact on those three categories of people that I mentioned, because they are at a greater risk to increase fear, anxiety, and moreover, depression down the road. So how we can stop this social avoidance and the social stigma is, first of all, by knowing much about the disease. So first of all, stop listening to the news. Because everybody now, as you can see in the news, everybody will go on the social media and talk about the disease, experts and non-experts. So what we say that
mostly non-experts.
Yeah. So what we say that the people, they should only listen to experts about the disease and its consequences, and this will lessen the stress and the fear. And the second, when you listen to this, then try to raise awareness in the community based on these notifications. And above all, you have to speak out when you see some negative attitude or negative reaction toward these people. So speak out and try to support these people as much as you can. And there are so many ways to support. It's just to engage with these people. So don't ignore them. So try to engage with them. And as you know, now there are so many sophisticated media that you can talk either directly through the phone, or you can video chat with them. By this way, you will reach to them and support them. It is very important in order to break the circle and decrease the tension they have. As I mentioned, as the consequences, some of the consequences of the stress that we have every day, that you will lose interest in your daily activities. You lose interest in sleep. You lose interest in talking to each other. And how we can overcome the stress, this is what is important. How we can overcome the stress. So there are several simple ways. And as you know, the first of all, be faith. So al-faith, al-iman. So read the Quran every day. So if you read a chapter from the Quran, or you read a chapter from a book, so this will ease the tension that you have. And exercise daily. So exercise and walk, have a walk outside, either in the yard or in the backyard, or go outside and have a little walk every day. This will decrease the tension you have. And another important thing is that you have to eat a healthy diet. So eat always a healthy diet and avoid snacks between them. And the best way to decrease the tension is to meditate. Meditation is very important. and everybody can learn it. It is simple, and it is a psychological meditation, which is a psychological balance between the brain, the mind, and the body. This will decrease the tension and will give you physical relaxation as well as mind relaxation. And the consequences of meditation, that it will help you ease the symptoms and the signs of stress, and will help you cope with the disease. And above all, that meditation may help with other chronic medical problems, because it is known that meditation will help to decrease your heart rate, it will decrease the blood pressure, and will help you have physical relaxation and mind relaxation. That is very important to ease these symptoms.
Absolutely.
And down the road, on the long run, as a consequence of this disease, you may have mental depression. That's why it is very important to watch people in your family members. If they have underlying chronic mental disease, make sure that they are taking these medications routinely, and you should provide this medication to them, because if they stop this medication, their conditions will accelerate down the road. Another important thing from being quarantined at home, and you know now most of the children, they are at home. There are no schools, and this is a great problem, because these children, they will feel at home because of the social distancing. They may feel lonely. So that's why it is important for the family to create for these children some educational activities, to create for them some physical activities and fun activities, so they will not feel lonely and will alleviate their tension and fear.
Absolutely. Are you noticing any increase for demand for medication, for like mental medication and relaxation medication and all of those medications?
For sure, yeah, because as I said, there's some group of people, this is not my specialty, but we hear from colleagues that there is increased demand, because especially some people, they have mental health problem, and this health problem will increase during this crisis. So there's definitely increased demand for this.
Are we going to be facing an opioid crisis after this with different people, because they're relying on, you know, medication to calm them down, even though they don't have a mental issue, but you know, they're just relying on this kind of medication?
Sure, there is increased demand for this, and that's why it is an obligation for the family to watch for their children at home, especially the teenagers, to see what they are taking, what they are doing, and look for any physical signs that may appear that will alert them that their children may be abusing some kind of medication.
What kind of signs? What should we look for?
So they should, signs that may appear like lack of appetite, sleepiness, they usually alone, they are avoid contact with people, avoid eye contact, they have increased tendency to sleep. So these are some of the worrisome signs that they should look for, and even look for the eye signs if they have some redness in the eyes. So these also are worrisome signs.
Okay. Now, if that's the case, would they require detoxation, or they can just deal with it at home?
That's why it is very important that the family, they should watch their children, see what they are taking, and always look among their belongings, especially among the teenagers. Look at their belongings, see what they are hiding. Try to discover this early, because the earlier you discover, the better.
Yeah, the less hassle that you have to deal with. Yeah, it can tear up families apart. And
yeah, of course, it's a vicious circle. If once it starts, you can never stop it.
Yeah, yeah. You've been also involved in the countering the opioid crisis as well, and you've worked with different groups to counter that. Could you share some of that with us?
Yeah, actually, we have started this several months ago, and now the COVID-19 crisis came, and so everything settled down.
Everything, yeah.
We already had a well-established program, and we had talks with other groups in the community who deal with this situation. And we are about to start a campaign, educational campaign in the community. And this now the COVID crisis cool everything down. And hopefully once it's settled, we would like to start it over again.
You did have a program with Access, is that correct?
Yeah, actually, the first meeting was at the Consulate of Lebanon. He took the initiative and called for a meeting. He called the different group and organizations concerned in the opioid crisis. We had several meetings. Unfortunately, few have cooperated with us, especially the Access. We had a cooperation with them, and we already started our own pamphlets and material together, and we are about to start the campaign together, hopefully soon after this crisis settled down.
Doctor, I had a question. I know that a lot of the times what we're seeing because of this current pandemic, patients are asking to be prescribed benzodiazepines, such as Xanax and Klonopin and Ativan and whatnot. What is your take on prescribing patients these types of medications? Because we know how hard it is for them to get them back off of this medication. What is your thought process? What is your approach?
You see, it's usually, as I said, I personally, I don't deal with this. I'm a general surgeon, and but this is what we hear, that it's advisable not to prescribe these medications until it is quietly essentially needed. And once you describe, you should only describe a number of pills, so and only one time, so they will not have access to get it another time. So this is the only way how you can control it.
Thank you.
So,
I think, Dr. Mohammad, we had in the beginning of the program, we have brother Wassim Mahfouz, that him and his organization very much are focusing on fighting drugs and dealing with this disaster, as a matter of fact, in the young community. And they are trying hands from either government or certain companies. I think if we can bring all these community initiatives when it comes to drugs, alcohol, and different challenges that we are facing, more communication among all the organization. And I know that you yourself, with your leadership and Amal movement and the Consulia, you have been doing lots of work in this area, but I think we need to coordinate these activities more and have to establish a closer communication and a closer relationship among all the organizations that are working on these critical issues, because really now drugs and depression and alcohol and everything. I hope now we are approaching the holy month of Ramadan and the season of fasting. That would be a source of spiritual help to deal with these difficulties like alcohol and drugs. But obviously we need also professional help in this area. And I think that if we can put together our minds, our hearts, our hands, our effort in this area, and you are and your organization is a very rich source of contributing to this movement. I wonder that how much of outreach from your organization and yourself towards other bodies that they are concerned about the same crisis.
Thank you, Imam, for this. Actually, we are open for all communication with all leaders and all organizations that are concerned in this. And whatever you suggest for the future that we can do, we are ready to cooperate. we are open-minded, and we tried in the past to communicate with most of these organizations. And as I said, unfortunately, we didn't receive much input from others. Our plan is that that every one of us is concerned about this crisis, and we have obligation toward our community to prevent this crisis from spreading. And this can only be done when all of us meet together and cooperate. So it's not that my organization will work separately or the other organization, they say we do what we do. It's a matter of trust, and it's a matter of responsibility that all of us are responsible, and we should sit on the table and do what is good for our community. It's not my benefit, it's not the benefit of my organization or anybody else. It's the benefit for the whole community, and we should come into agreement that what we do is for the welfare of the whole community.
Thank you.
Thank you, Imam, and happy Ramadan to all of you.
Thank you so much. We really appreciate it. We appreciate everything you've done, and you've been a good friend of this community. And you know, every time we seek you, you're always there, and you're very generous with your information and your leadership. You know, and we really appreciate it. Thanks again. And we may call on you during Ramadan to talk more about these issues. You know, as you well know, right now, it's very difficult to you know, to congregate because of the coronavirus. So we may be doing the program, you know, online like we're doing right now. Thanks again. We really appreciate it. You know, and may God bless you.
Thank you.
You, Doctor.
Thank you, Said. Thank you.
Absolutely. We go back to Mahdi to share with us more information, how we can support the programs at Islamic House of Wisdom, and how we merged into different services, you know, and we're still serving the community. Go ahead, Mahdi.
Yeah, definitely. I just want to say assalamu alaikum for anybody who has just joined us throughout the broadcast. Thank you to Dr. Mohammad and our donors and our panelists. You know, they asked Abraham Lincoln, they said, how long does it take for you to prepare a 10-minute speech? And Abraham Lincoln said, for a 10-minute speech, it takes me 2 weeks to prepare for it. Then they said, Abraham Lincoln, how long does it take for you to prepare a 1-hour speech? He said, 1 day. Then they asked him, how long does it take for you to prepare a 2-hour speech? He says, I can start speaking right now. So sometimes the shorter, the better, the simpler, the sweeter. I want to thank all the panelists who have respected their time slot. They gave valuable information in the shortest amount of time, the essential information that we need to continue living our life through this pandemic. I want to highlight some of the services that the Islamic House of Wisdom has been providing for over 25 years. You know, it's not something easy to say that an establishment has been doing something for 25 years. Many businesses, they don't last that long. For the Islamic House of Wisdom to say that for 25 years we have been establishing a presence in our community, establishing youth programs, social services, the fact that we're providing 1,000 meals a day to over 800 different people with the help of our community, that's something to really celebrate. That's something to really take a step back and understand and realize, wow, we have a mosque, we have a community that no matter what happens, no matter what situation we're in, we come together, we support one another. We have to really appreciate this institution, all the other organizations that have come together and really made sure that people are safe and healthy, the educational opportunities that the Islamic House of Wisdom has provided, whether it comes to their Arabic school, their Girl Scouts, their Islamic seminary classes, so that people can really, like I said, understand what their purpose is in life. A lot of the times when we have extra time laying around, we start to forget what is the purpose of life. We're so bogged down with distraction and entertainment that we forget what the purpose of our life is, what the purpose of our existence is, who our creator is, and what our final destination is. These are critical questions that if we have the time to really sit down and reflect upon them, we can find purpose, we can find value in our faith. So please support your Islamic House of Wisdom, the counseling that we provide on a daily basis, no matter what the time is. When Imam Elahi receives a phone call, it doesn't matter what time it is, he will answer that phone call and he will respond to the needs of the people. Please do your best to support, no matter what the amount is. I want to thank the donors, Dr. Mohammad Ajjour, Hajj Mahmoud Muhajiri, Brother Abbas Harajli, Dr. Hassan Amiri Kier, Brother Bilal Hammoud, Hajj Charles Khalil, Brother Ali Joseph, Sister Kara Batau, Dr. Paracha, Haji Vicky Ashkar, Mr. Bagaman, Brother Turfa, Sister Mafi, Dr. Harp, Brother Bahasad, and Sister Mariam Saad. Thank you for your kind contribution, and for all of those that I may have missed. Thank you. Your families, your loved ones, your friends are in our thoughts and in our prayers. We wish you the best. I also want to thank all the healthcare providers who on a daily basis are working towards fighting this pandemic, keeping our community safe and healthy. Thank you very much.
Thank you, Mahdi. I really appreciate it. And, you know, one thing that a lot of people don't realize is the fact that this opportunity is there for them to help others. And they don't have to do anything except providing the support, whether it's a support of material, whether it's monetary support, and this is why it is there for them. And, you know, we've taken the time to provide this opportunity, and we hope that people, you know, that they cooperate with us, because this is something so important. If we're going to continue what we're doing, which is serving the community in different capacities and providing programs, this is the time to really do it. And this is the time to really help and provide the help that is really necessary. If there is any time you need, you know, you want to support our services, this is the time to do it. This is the time.
There is a hadith, said Khalil, from Prophet Muhammad, peace be upon him. He said that Tuba liman ja'alahu Allah miftahan lil khayr.
Absolutely.
Blessing that someone chosen by God to be key for al-khair, what is good and what is blessing. Then he said, إن الله إذا أحب عبدا استعمله. When God loves a servant, a person, he would use that person. قيل يا رسول الله كيف يستعمله? What do you mean that God would use someone? قال يوفقه لعمل صالح. God would bless him to do something righteous, something useful for people's education, for welfare, for prosperity, for their safety, and any service that is a good service that serves the society. That is a blessing, that God would choose someone to participate in the race of yusari'una fil khayrat, that they compete to do what is the best for their family, for their neighbors, for their communities, and obviously those who, as you mentioned and Mahdi mentioned, support an organization like Islamic House of Wisdom. They help this institution to again help us, to help our community, to help our faith, to serve us in faith level, education level, you know, promoting peace, promoting justice, promoting what is good for community, for country, for humanity. And we really appreciate those who are supporting us with their words, with their deeds, with their financial contribution, with their ideas, with their time, with their talent. May God bless you all for serving the house of Allah subhanahu wa ta'ala. Thank you all.
Absolutely, absolutely. And we're going to continue our program, and Dr. Shady joined us. Good afternoon, Dr. Shady.
Hello, Salam, how are you?
Good, how are you? We really appreciate you taking the time to be with us.
Thank you for having me.
Absolutely. Please, for those of us who are not familiar with you, tell us a little bit about you and what you do and where you practice.
So I'm Dr. Shebak. I'm a psychiatrist, and I practice in Dearborn, Michigan, at Core Psych PLLC. I'm also faculty with Michigan State University, where I teach residents and students about psychiatry, and they come and rotate with me in the clinic. At the clinic, we offer virtual appointments, phone call appointments, and face-to-face appointments. And we haven't closed during this pandemic, but we've shifted a lot of our to virtual psychiatric health and mental health care as well. So I'm the psychiatrist there. We have several PAs and NPs, nurse practitioners and physician assistants, and then we have several therapists as well and psychologists that work with us.
Yeah.
And before that, I used to work on an inpatient unit children.
What's the difference between psychologist and psychiatrist?
So a psychiatrist is a medical doctor, either an MD or a DO. So medical MD or a doctor of osteopathic medicine. We go to med school. We go through all the rotations that all the other physicians go through. And then we have to go through residency training. So the residency training, we do internal medicine, neurology, emergency room, and then we focus on psychiatry.
I see.
Psychologists, on the other hand, are PhDs. They're focused more on therapy as well as psychological testing, if they need to be tested for someone for IQ or intelligence or autism. And then there's other people that also provide therapy, like social workers, mental health therapists, etc.
Okay. Which one can provide prescriptions, which one don't?
In Michigan, psychiatrist provides prescriptions, and physician assistants and nurse practitioners also provide prescriptions under the supervision of a medical doctor.
Medical doctor, yeah. And how is this current crisis really affecting our psyche?
I think that's a loaded question. I think even me, I'm starting to get a little cabin fever. There's a difference between a little bit of cabin fever and feeling isolated and bored and annoyed and irritated and all that. And then when it crosses over to a mental health problem where it actually starts functioning with your ability to function day to day. So, once you start becoming hopeless or helpless or extremely sad, or you have thoughts of wanting to die, or you become anxious and you start having panic attacks, or you're constantly anxious about the future, or you're ramping up, you start becoming hyper religious. That's a thing, where you become, all of a sudden, you were someone who prayed your 5 prayers, and now you're praying all of Salatul Layl all the time, which is something that, we should praise, but we should also keep an eye on someone who has a rapid change behavior, because that could be a sign of mania or psychotic break or psychotic illness. So while, of course, we encourage people to do Salatul Layl and to read Quran, if it's a rapid change in behavior and it's not a gradual change, that's a telltale sign that something may be going on. Something may be changing in that person. That's where things cross over from just regular discomfort and anxiety that we all share and have, to a mental health problem. So consistent anxiety, consistent ruminating about the future, panic attacks, extreme depressed mood, worthlessness, helplessness, psychosis, hearing voices, seeing things that aren't there, ramping up in your speed, and your thoughts are racing. These are all telltale signs that something may be wrong.
Okay. What should we do as we are confined in our homes so we don't get to that point? I mean, what are some of the things that we can do to?
I think some of the things that we can do is stay connected with family and friends, but also it's so important, I think, and I made a talk about this a few weeks ago, about social media and also taking a break from social media, because that can be extremely anxiety provoking. For example, I said in my talk that long time ago, right, long time ago in the 90s, right, when we used to go home, we would go home and that was it. We were disconnected from the world, and then we were just with our friends and family. Now when we go home, we are logged into the social media, so it never stops. So we're constantly being bombarded with information and things, and even with people that we may not like or get along with, or we may see things all the time that stress us out. So it's also important to recognize when that's happening and to take a break. Because that can be also detrimental. We're not made to constantly be connected, but we're also social creatures, so we want some social connectivity. But if it gets overwhelming, it's okay to take a break and to admit to yourself that, hey, this is not working for me. I can't see any more people's faces or people's pictures or people's statuses or whatever, right? And I'm just going to take a little break from this, and I'm going to go to something else to stay connected, maybe Zoom, WhatsApp, or something like that, where I can have a specific small niche of friends that could be my support.
Yeah, yeah, and you know, you mentioned something very important, because I notice most of the stuff that's sent to me, it's either inaccurate, you know, it's like a conspiracy, or and then there are a lot of people who would just start sending to each other without really evaluating, you know, what kind of material was that, and you know, it just, I just can't believe the amount of information that's been, you know, moving around WhatsApp and other, you know, social media and Facebook, and today everybody is an expert. This is the other problem. You know, I mean, I remember going to school for years and years to become a journalist. Now today, everybody's a journalist. You know,
society is moving from society of discipline that was really around in the 1900s, where you go to school for 12 years, then you go to school again for like 4 or 5 or 6 years. So each time you're starting over, and then you go to a job, and then you become an expert in your job, and then you retire, right? Nowadays, it's all mixed in with each other. There is no end to schooling. There is no end to work. There is no end to social gatherings. There is no end to anything. So you're in school for your whole life. You're in work for your whole life. You're in social situations your whole life. There's no break. And I think that's something we should also keep in mind and say, hold on a second. Maybe we need some discipline in our lives, and we need to also have some type of hierarchy or what have you when it comes to certain fields of expertise and things like that. But this is a societal change that's happening, and I think it's something to at least be aware of, that nowadays there is not a lot of, everything is so mixed up with itself. Everyone is everything, and that's something we have to, the first step is to recognize it and then to find a solution. The solution is going to be very difficult, but at least we should recognize it so then we can start brainstorming on how to address this new society that's emerging.
Absolutely, absolutely. Now, in our community, what are some of the prevalent problems that normally you deal with that now could be exasperated?
Okay, so I think there's a couple things. So Islamic culture and Arab culture tends to be very, very much linked with family. But to some extent, I think a lot of us have lost that way. So that in normal times, I'm not going to say most people, but a lot of people are never home. You know, they come home to eat and sleep, and then they're out for the whole day with friends or at work, and then they go out later for friends and things like that. So this quarantine, I think, has really shown us that there's a crisis of family going on with regards to we're not used to being around each other. Everyone's getting on each other's nerves on a lower, I mean, on a just from what I've heard from people, you know, people calling me and talking to me, and I think that shows a crisis in family. So I hope that we can take this moment to us and recalibrate ourselves to become family oriented again, because I think we've lost our way over the years. I'm not saying everybody or most people, I'm saying from what I'm seeing anecdotally, I think we've lost some of that. And now that we're stuck together in a house, people are very agitated and are getting on each other's last nerve. So I think after this crisis settles, I think we should take a moment to reflect and to try to make it a point to spend more time at home with mom, with dad, with family, and not always be on the lookout for going out or doing something or being active everywhere in the community. Yes, be active in the community, but part of the most important structure of a community is the family, I think. And we have to come back to that.
Absolutely. You know, to make this work, it requires quite a bit of tolerance. You know, I mean, right now, all of a sudden we're confined with our families and we have to be together for, you know, I don't know how long. And to make it work without, you know, a lot of friction, you need a lot of tolerance. I mean, how do we all of a sudden we want to learn this tolerance?
I don't even think, I think you're right. I think it needs tolerance, but we also need to get to know one another. This is a time for us to know each other. A lot of families don't know each other. We're realizing that. We live with these people, but we don't know them because we just go home to sleep and eat. And, you know, even husbands and wives don't know each other. They just live together, they're roommates. So I think that that's something that we really have to think about, using this time, not just to be tolerant of one another's behaviors, but to start to really have those conversations with one another of what do we like to do? What are our habits? What are our thoughts? What are we thinking about? What are we reading? What are the new things that we've been thinking about during this time of quarantine? So in a way, kind of reignite getting to know one another as the family, you know, because I really don't think a lot of people know their family as much as they think they do. I think a lot of times digital footprints and social media and things like that know more about us than we know about our families, or our families know about us.
Yeah, Dr. Shady, you directly in your profession, you obviously deal with depression and mental health in the community. And how do you see that problem is more complicated during this crisis of coronavirus? And because we observe some tragic cases in the community in recent days and recent weeks. And what is your take of this general is getting worse, and how the families should deal with this depression issues and mental suffering issues? And I know that we always ask people to pray, month of Ramadan, استعينوا بالصبر والصلاة. I mean, we don't deny the power of prayer and spiritual healing, but at the same time, scientifically, from your professional point of view, and working in the community for a long time, and both you are a person of faith and science, religion and reason, you, mashallah, combine both of them. So what is going on at this time?
So we know that domestic arguments and domestic violence is increasing all around the world, not just America, in Europe, in the US, in the Arab American community probably is not exempt from that. What we want to do is we want to find the warning signs that we can, because there's some things that we can deal with by someone talking to a friend, and someone talking to an imam, and someone talking to their family. And then there are some warning signs that you just cannot, that need professional psychiatric help. So I do think that this quarantine and this isolation is even normal. I mean, I don't, you know, my diagnosis aside, I don't have nothing too serious, but I'm feeling anxious and isolated and restless. So it's obviously going,
which is normal.
Some of that is normal, and some of it could be could start to tip over the boundaries of normal, right? So if it gets everything, there's a spectrum of behavior, and anything can start tipping to that boundary. So someone who's never had mental health issues may actually develop some mental health issues from this. So they may have the normal anxiety, and then that anxiety gets worse and worse and worse, and then boom, now they have a chemical issue in their brain. Other thing that we should also pay attention to is people who have issues of abuse, substance abuse, that are no longer able to buy their drugs. And I'm not saying they should. What I'm saying is that we should recognize those people and send them to the proper physician or a proper help so that they can get the medications that they need to keep them from, to hopefully be a time of cleansing for them, and they can get on the medication-assisted treatment and therapies for their substance abuse problems. Because if someone is addicted to alcohol, for example, and they can't buy it, I think it's essential in Michigan. But if they can't, but let's say they couldn't get out of the house to buy it, they could be at serious risk of dying from alcohol withdrawal. Similar with someone on opiates, they're not going to die from withdrawal, but they're going to be in an awful amount of pain and suffering. So these people we should look at for those warning signs and send them to the proper person for help. With regards to issues of violence, there's often signs before a person acts violently if they are acting violently because of mental illness. So some people act violently out of impulse, and that's the most common form of violence. All of us can act violent out of impulse. So that's not a mental illness. Hurting somebody or beating somebody is not necessarily a mental illness. What is a mental illness is if someone is ramping up, they're all of a sudden manic. Like I said, they're hyper-religious, they're talking real fast, they think they're communicating with God, and they have all this energy, and that can cause violence. So once you see someone starting to ramp up, it's time to make them, get them the help that they need from a mental health professional. Before that, if it's just mild anxiety, they can talk to their friends and family and imams, and that's important. Even if they're ramping up, they could still talk to the imams and their families, but it's time to guide them in the direction of professional health care in order to give them the medications that they need. Because at that point, mood stabilizers. Similarly, if someone's depression is getting to the point where they're not getting out of bed anymore, they're sleeping till 4 in the afternoon, or they're not sleeping at all at night, right? That's another sign of depression. And they're starting to express things like, life is worthless, I'm hopeless, I'm helpless, or they start to exhibit change of behavior. It's time to get them the professional help so that it doesn't spiral out of control, because these are telltale signs that something is not right. And violence can be inflicted on somebody or on the self, right? So you can have thoughts of violence on yourself. People will cut themselves or try to hurt themselves or overdose or, kill themselves. Or they can act out that violence and that frustration on someone else. And if they do have a history of mental illness, it is a very important time to check in and keep an eye on that person to see if their mental illness is in check and it's being treated correctly, and if it's being treated with, and if they're taking their meds as they're supposed to, or else it could spiral out of control. And that's what I fear about. That's one of my fears, is that some people that are committing some violent acts may be people who have diagnosis of mental illness or mental health that are not taking their medications, or that are not getting the proper support and care that they need. And then that kind of spirals out of control.
Absolutely. Now, when it comes to children, like, for example, my children get to a point where we want to go out, want to do this, want to do that. What can we do to help them ease that lockdown?
I take my kids to the park. Fortunately in the US, parks are still open. There's countries like the UK, I think parks were actually closed, but alhamdulillah, here we have some common sense that we kept some things open. So I take them to the park, we go for walks. Sometimes my wife will take them for a car ride because my kids are very young, they're 3 and 4, so they have no idea what's going on. Exactly. And they're extremely restless and bored. So we also bought paint supplies, so we do arts and crafts at home. Unfortunately, they watch a lot of TV too nowadays, because at the end of the day, you can only do so much arts and crafts before you go crazy. So we do take them to the park, though. We do go outside. We go to the backyard. We've been doing some work in the backyard. These are all safe activities that I think we should really take advantage of and do.
Dr. Shady, you mentioned, people being hyperactive, but from your experience, do you see more people ramping up or ramping down in their behavior with this current pandemic?
It's hard to say, especially if someone has both the anxiety, which is a ramping up, and a depression, ramping down.
Right.
So I look at it like this. Are they starting to focus on regrets from the past, or are they focusing on anxieties of the future? That's how I kind of differentiate depression and anxiety. Oftentimes in my head, is depression and anxiety are similar. Depression is a focus on the past and sadness and hopelessness and helpless about the past. Anxiety is a fear of the future. But you could see both. Someone can have both a ramping up in their thoughts and a ramping down in their body, or a ramping up in their body but a ramping down in their thoughts, or too much sleep or too little sleep, but they're still very depressed, because depression can make you restless at night and not sleep. So it's probably a mixed field out there with ramping up and ramping.
And I know that the treatment could be similar. It could be a little bit different. I was asking the doctor that was on before, but since you're a psychiatrist, you're more focused on more of mental issues. Correct me if I'm wrong, but I know that the antidepressant medications, they take a couple weeks to kick in. I think the number was around like 3 weeks for antidepressants to kick in. And, sometimes people are looking for something more immediate given the current climate and situation. What is your approach with prescribing benzodiazepams like Xanax and Klonopin and lorazepam and whatnot, because of how hard it is for taking these patients back off of these medications? It's easy to initiate them, but especially with your benzos, it's so hard to take them back off. What has been your approach with your patients?
I've definitely been prescribing more of the benzos lately. I don't prescribe much Xanax because it's too difficult to deal with. It has too short of a half-life and all that. But I have been prescribing a little bit of Klonopin and Ativan to help people ease their anxiety. So I'll give them, for example, I'll say, I'm going to give you 10 tablets, but it's got to last you the month. That way, you cannot get addicted to it with 10 tablets a month. There's just no way. Addiction takes 4 or 5 tablets a day for a long period of time. So I have no problem in giving someone the help they need in an emergency situation. for a short period of time and a limited amount of supply. So 10, 15, 20 tablets a month for somebody who's really struggling and suffering. That's the benefit outweighs the harm and the risk.
How do you tell if somebody's really in need of the medication and not? I know it could be a very fine line with your patients, and there's a trust issue that has to go with it. As a healthcare provider, you have to be trustworthy. You have to show that you trust your patients. But where do you draw the line of, is this person actually feeling these symptoms or not?
So with patients, I always run a map, so I check what meds they've been getting. If they've been on a benzodiazepine for 10 years, I'm not going to stop it. That just doesn't make sense. And if they've never been on it and they're really suffering with something, then I can trust that they're not looking to just get medication. So it's like kind of like a gray area.
Right.
And experience, obviously professional experience and knowing these people. And a lot of the people that I have added some Ativan for are patients that I've been seeing for about a year now that just really needed it. So these people, I'm not, it depends on the person. It depends on my experience and what I'm seeing from the person. Are they coming into my clinic high and smelling like marijuana and or coming in with telltale signs, or are these people really, really struggling with severe anxiety?
Thank you. Everything is more individualized. I understand. Thank you.
And what about Dr. Shady? Probably some parents come to you and concerned about their kids that cases that they may abuse the medicine that they receive, and they are frustrated how to deal with the kids, that things are getting out of control and the parents getting helpless of don't know how to deal with that. Have you cases like this?
Yeah, so like I said, most of the medications that we use, that in psychiatry that we use, are not things that you can abuse, even if you try. You can't really abuse Zoloft, You can't really abuse, other medications like mood stabilizers. You just can't. It's more of an issue of a toxicity at that point. But they're not medications of abuse. The medications of abuse are a few medications that we have to just be careful when we're prescribing to make sure that we're doing it appropriately. I'm not a purist, meaning I don't say never give this medication. There's always room for something. The other thing with kids and with adults as well is I've been recommending that they start therapy as well, talk therapy with one of our therapists. We've been doing those on Zoom and phone calls. So we can't also forget that therapy and psycho-behavioral methods are going to be very helpful at this time. So it's not just medications. It's also therapy. And even when they come and see me for medications, that's also a therapeutic appointment. That 10 or 15 or 20 minutes that you're spending with the patient, that's also there is some therapy going on there. So therapy, medications, and with parents, at the end of the day, when they see that the problem is getting really, really bad, they're usually open to suggestions.
Absolutely. Well, I just want to thank you for taking the time to be with us. This is valuable information, and I just can't thank you enough. If anybody needs to reach you, is there, would you like to share your information?
Oh, sure. So Core Psych PLLC. We're located on 3815 Pelham Street in Dearborn, and our phone number is 313-722-4683. And we are able to see people almost immediately because we have several providers. So we always have one person there that's able to see people if it's an urgent situation that they need to be seen right there. So we always have some capability of squeezing someone in.
Absolutely.
The other thing I wanted to say is I wanted to thank Dar al-Hikmah, the Islamic House of Wisdom. Me and Sheikh Elahi go a long way when I was having spiritual crisis when I was younger. So I want to just extend a sincere thank you for Dar al-Hikmah, the Islamic House of Wisdom, and for everything that you guys have done for the people and for me personally on a personal level. So thank you.
You're very welcome. You're very welcome. Thank you so much for being with us.
All right.
We're going to go back to Mahdi so we can learn more about how we can provide support for the programs and the services we provide, and also, read some of the letters if we have any that we need to leave.
Yeah, for sure. I just want to say assalamu alaikum for anybody who has just joined us. You can support the Islamic House of Wisdom and its initiatives through the link below the Facebook Live, and also you can call us at 313-359-1221. All it takes is your name and your payment information, It'll take less than 1 minute to support the initiatives that the Islamic House of Wisdom is a part of and the things that they support to make sure that people are healthy and safe during these times. Another topic and another area of interest that the Islamic House of Wisdom delves into is interfaith and media engagement. You know, on a daily basis, Islamic House of Wisdom has connected with our local, national, and international interfaith communities. I mean, you probably have seen and heard of some of Imam Elahi's interfaith engagements, yet now more than ever, we must stand to make our communities stronger. Now is the time for us to understand and realize that we are all united under one God. And Islamic House of Wisdom has done this time and time again. It doesn't matter what the situation is, we have always opened our doors for interfaith communication. And that's something that we will continue to do, and is something that we are doing irregardless of the current situation that we are facing. Even in our daily food distributions, you know, you would think that the Islamic House of Wisdom is only open for Muslims. But a lot of the times what we're seeing is people who are even non-Muslims are coming to the masjid to receive help, to receive food for themselves and their relatives. You know, and they've expressed deep appreciation and have mentioned that they are now following our online programs and activities. I mean, when you hear something like that, that is something absolutely amazing, that you're hearing from non-Muslims that, look, I just realized that there is a mosque in my community, in my neighborhood, that is offering help. It does not distinguish, it does not judge what race, what color, what religion that the person may have, but yet it still opens its doors. And we have heard expressions and we've heard responses that they're saying, we have now tuned into some of your programs to get to know the mosque that is in our community. That is something that is actually magnificent news. In terms of the media, I mean, constantly the media has contacted the Islamic House of Wisdom and Imam Elahi. They want to know exactly how we are offering our help to the community. They want to learn what our faith says in regard to times of crisis. You know, a lot of the times people are thinking, how do I approach the current pandemic? What is it that we need to do? And, you know, we've had multiple doctors on our panel today, and we've heard the same common trend. They're saying that, yes, medication may be needed. Yes, there needs to be medical attention, but there's also the spiritual aspect of things. There's a way to approach things from a spiritual garb, from a spiritual background. Both of them go hand in hand. Both medication and meditation are required for us to get through any type of disaster. And when the media calls and says, how does Islam, how does your faith approach disasters like this, it opens up an opportunity for us to educate both Muslims and non-Muslims tuning in just how beautiful this religion is and how it caters to the needs of all the people, regardless of what crisis that they're going through. We have received support through letters. You know, we have a letter from Dr. Talal Turfa, who has congratulated on the 25 years of success. Dr. Thomas Walsh, the chairman of the Universal Peace Federation, he has also expressed his gratitude and his gratefulness to the Islamic House of Wisdom. 25 years of wholeheartedness and dedication, service to the community, society, the nation, and the world. Kind words from him, and also from Dr. Kathy Khalil, who says, courage, determination, forward thinking. These are the words that describe the Islamic House of Wisdom and Imam Elahi. I want to thank all of them for their kind words. I want to thank all of the donors who have taken the time to donate. Some of the names are Brother Ahmed Nasser, Haji Nawal Hamadi, Haji Sabah Baidoun, Sister Mary Asseal, Sister Mona Amin, Sister Safa, Brother Safa Musavi, Sister Mukbil, Sister Mona Hammoud, Brother Ali Fawaz, Patricia Kelly, Brother Firas Hamadi, Brother Mohammad Mu'takif, and all the other generous donors who have tuned into our program today and taken the time to contribute to their local mosque, which in return is helping to satisfy the needs of our community. Thank you to the donors. I want you to think of how many times you, your friends, and family members have attended our programs. Think of the effect it has had on you. Now put a price on it. Maybe you want to become a sustaining member and have $50 a month, $25 a month, $10 a month, easily deducted without a hassle to help continue these programs. It's time to make your tax-deductible donation. You know, you hear bad news all around you these days. Everyone is coming and overcome with fear and uncertainty. How about you give yourself good news today? A gift of satisfaction of being part of something worthwhile in these trying times, and the reward of the akhirah and this dunya, inshallah, will find its way to you. Like I said, there's a link below the Facebook Live, and also you can give a phone call, 313-359-1221. It'll take less than a minute to show your support. Thank you.
Thank you, Mahdi. I really appreciate it. Again, I can't stress the importance of taking advantage of this opportunity to, I've used the food line a couple times, and you go there in the morning and there's all these cars just lining up to get services. All of the I know that Imam, people calling him maybe till like midnight. They continue calling him, asking for support, asking for to talk to him, to get guidance. The office is still open, and all of the services are still available in a different way. So, and we need your support to keep them, to keep providing these services. And again, if there is any time in the history of this organization that we need your support, it is now, so we can continue serving the people who need it the most. And then there's, I want to bring your attention to something. There's a group of people who, nobody really knows about them much, but they do turn to Islamic House of Wisdom for support because of the secrecy, because they don't want people to know that they're in need. And I know for a fact that Islamic House of Wisdom does not turn anybody away. Can we help more people? Of course we can. It's all about resources. And if you provide us the resources needed, then we can help more people. And I don't know if Imam has anything to add before we can welcome Dr. Kamal.
Dr. Kamal is a beautiful name. He is Kamal and he is Khalid. He is
Khalil.
His name means perfection, and Khalid means eternal. And really, his wisdom is very inspiring, always brings energy, brings hope, brings knowledge, and a great contributor to our community, and very, very sincere supporter of Islamic House of Wisdom, both himself, his wife, his family, and is very much encouraging. And we are so happy that as we are approaching the holy month of Ramadan, we learn from his wisdom and his own spiritual preparation for the holy month of Ramadan. And because really Ramadan is a very, very serious season, and we want to make sure that we would inshallah accomplish something out of this holy month of Ramadan, and we see some transformation in our life and some real changes in this world, and bringing some hope and some blessing for us, for our families, and engagement of Dr. Kamal, always appreciated. Very welcome, Dr. Kamal.
Assalamu alaikum. How's everybody doing?
Thank you so much for taking the time to be with us.
Can everybody see me clearly? The Gobas and Najis always says I have a face for radio, so maybe it's better. I put some cologne on if that helps.
It's perfect.
We can smell it and it smells good.
Fantastic.
Yeah, thank you so much for being with us, and we really appreciate it on this Sunday afternoon. And just tell us a little bit about you and what you do and the message that you want to share with us.
I'm just a simple guy. I'm a father. I'm a son. I'm a brother. And I'm a student, and I'm trying to find my way spiritually. And I owe a great debt of gratitude to the Islamic House of Wisdom. I actually said this during a presentation once, and I mean it with the utmost respect, that I used to find Imam Elahi the most annoying man on earth, and annoying in the best of ways. That is, every single time I've ever asked him for a favor, any single time I've needed something, I've come to the Islamic House of Wisdom, and he's always said yes. I'd appreciate it if he said no sometimes, because I feel that when we ever started raising money for our Islamic studies program, or whenever my two sons were born and Musa came from Morocco and Ihsan, we needed to do his aqiqah. He's always been welcoming. He's always served us, and he's always given us inspiration and wisdom. And I think that it's frustrating on my end, because if you ask me for a favor, I won't pick up the phone. He'll go the extra 10 miles just to serve his community. And I really appreciate that from him and the Islamic House of Wisdom.
Absolutely, absolutely. And what do you do now, Dr.
So I do I did a lot of cancer research, a lot of Parkinson's research, and I run the mental health task force for the city of Detroit.
Oh, okay. This research is associated with the city or associated with a...
Oh, no, it's independent.
Oh, independent. Okay.
Yeah.
Where are we in these studies?
In regards to Parkinson's and the specific... With Parkinson's, we've made great advancements with the incorporation of certain therapeutic indications. On the glioma level, for glioblastomas multiforme, once again, it's a very aggressive tumor. And oftentimes there's palliative care, but there's a new drug called temozolomide, which is now first line of defense. So alhamdulillah, it's a work in progress. It's a never give up attitude. There's people who are much more committed and much more knowledgeable to me, so we owe them a great gratitude.
Yeah. Is there anything we can do in our lives to prevent or slow down the disease?
I mean, to be honest with you, it's pretty standardized care of having your regular checkups, being mindful of what you eat, performing regular exercises, being spiritual in your ways, and generally leading a healthy lifestyle. There's a genetic component to it, but even when we're a disease inflicted upon us, I mean, right now I call her the Queen of Yemen in the south end of Dearborn, and she has the greatest masiba I've ever seen. When she's been recently diagnosed with a form of cancer. And for most people, it would have been the end, but for her, she continually fought it. She was continually spiritual. So I think it's a mind over matter type of situation, having faith in your Lord and leave the outcome to him.
Yeah, yeah. You know, mental strength has proven to be tremendous in cases like this.
Absolutely.
Yeah, yeah. I understand that you want to share a message with us in regard to Ramadan.
Yeah, so if I can start. الله غفور الله الرحيم الله يحب المحسنين وخالقنا ورازقنا وهو على كل شيء قدير بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألم تر كيف فعل ربك بأصحاب الفيل ألم يجعل كيدهم في تضليل وأرسل عليهم طيرا أبابيل ترميهم بحجارة من سجيل فجعلهم كعصف مأكول صدق الله العلي العظيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين خاتم النبيين محمد اللهم صل على محمد وعلى محمد. You know, I'm not an intellectual person by any stretch of the imagination. And Imam Elahi, I'm going to provide some wisdom, and the wisdom I get, I receive from him. And I cannot quote the Quran, and I cannot quote scholars, and I cannot quote theologians. So there's an interesting line by a lyrical poet by the name of Marshall Mathers, where he said, you better lose yourself in the music the moment you own it. You better never let it go. This is our one shot, and do not miss our chance to blow. This is an interesting and concerning time where there's a great amount of fear within our community, within our state, globally in regards to this coronavirus. And I don't understand why. I really don't understand why. I think this is a great test from our Lord. We can either take this as a test or as a punishment. But now we are at home. We are engaged with our families. We're engaged more so in communication with our friends online. And this is a great opportunity for us to reflect on ourselves and actually return to our Lord. You know, unfortunately, last year on April 19th at 7:36 p.m., I received a text message from a sister from our community. And she stated that she has ovarian cancer and it has metastasized. Alhamdulillah, she fought the best she could fight, and it was up to her Lord, and her Lord decided to take her 3 months later. In the past year, we've seen death of various forms. We've seen disease, and we've seen destruction. There's this mantra of, because of this coronavirus, that a lot has been taken away from us. The ability to go up to the restaurants, the ability to go to parks, the ability to go to movies. Which I understand, entertainment is a form of life. But this is one of the greatest opportunities I believe I've seen in my life. Now, the more, I'm still an immature human being, but the more immature human that I was previously would have been frustrated or angry. But I think this is a great test from our Lord. You know, this month of Ramadan is coming, and you don't know what you have until it's gone. This year, the Islamic House of Wisdom and the rest of the masajid will be holding online lectures most likely. We won't be able to go there for iftar. Imam Elahi may be forced to cancel the interfaith dinner iftar he has, which is a great disservice to me because I truly enjoy it. And the lectures will be mostly on the computer. For other members of our community, an institution of Salatul Tarawih will no longer be performed in the masjid. But should we be sad or should we be alerted? I think it's very fortunate for us to be in this situation because now let's take a look at ourselves. We work from 8 to 5, 9 to 5. We come home and we relax a little bit, specifically in the month of Ramadan, and we engage our families. By 9 o'clock, we have iftar. By 10 o'clock, we'll have prayed Salat al-Maghrib and we'll have eaten dinner. And then we need to either enter the masjid or just relax at home. It was a bit disconcerting, and I'm not putting anybody on blast here, but I just sometimes would like a more spiritual forefront for our community. Last year, there was a food festival in the month of Ramadan, held every weekend, I believe, and I didn't understand why. From 11 a.m. to 4 a.m., from the end of Salat al-Isha, or the end of Salat al-Tarawih, or the end of a sermon at the Islamic House of Wisdom, till Salat al-Fajr, you have 5 hours. I'm not going to spend that 5 hours attempting to line up to eat a shawarma or eat some kunafa. We have 5 hours to pray tahajjud, to read some Quran, to be close with our family, to sit alone and reflect. Or if you don't want to do any of those 4, we can sleep till Fajr so we can wake up on time, we can have sahur, and we can start our day. Our priorities may be slightly distorted. You know, there was a deacon at work, and he always told me, and he was a great Catholic deacon, he always told me, Muslims will become Catholic, not in terms of their faith, not in terms of their deen, but in terms of their ability to engage the religion. Because Catholicism, in essence, during the late 1800s, early 1900s, the churches were full. But as time went on, the attendance started to decrease. People left religiosity and stated that they became more spiritual. So there was this disconnection between them and God. And I'm fearful, now that I've become a father, that this may happen to my kids and the kids of the entire community. This is why this Ramadan is extremely important. We have the ability to return to our Lord. And I think this shouldn't be manifested into something minor. This is great. Last night, unfortunately, one of the stalwarts of my community, Dr. Mohammad, passed away, or we found out he passed away, actually. With this whole coronavirus, funerals have been slightly distorted. So we were unaware that he was even buried. But a pillar of our community who served humanity. He served humanity. If I were to ask him, God rest his soul. If I were to ask Raufa Bazi, God rest her soul. Or if I were to ask the Queen of Yemen, who was unable to fast this year, would you want to enter this month how you previously entered? They would beg for it. They would beg for it. We have 30 days to cleanse our soul, to heal our wounds, and to restore integrity in our spirituality. And I think this should not be undermined. I think it's really important that we do so. You know, the Islamic House of Wisdom never fails to promote some type of programming. They never fail. And you know, this is why it's an honor to be speaking with you guys today, because from the Islamic House of Wisdom, and Imam Elahi, you stated this yourself, that you stated, those who do not learn from their past are doomed to repeat it. We're allowed to disagree, but we're not allowed to destroy. This type of mentality, this type of integrative thought process is what we need specifically in the month of Ramadan. So now, most likely, the masjid will be closed for a certain period of time in Ramadan. What do we do? The same thing we should have been doing, just more. Maintain the integrity of our prayers, maintain our charity to the Islamic House of Wisdom, to those who are suffering, to anybody. Attempt to redefine ourselves spiritually. Learn something new every day. Be diligent in what you learn, but not only in what you learn. Use what you've learned and teach it to others. Use what you've learned and provide that wealth of knowledge to your children. If you don't have children, there are children in our community who are fatherless, who are motherless. By default, the Quran states that those who respect the yatim and the orphans, that there's a great blessing for them in the hereafter. Be their spiritual guide, be their mentor, be their father, be their mother. In essence, we have the ability to be great. We have the ability to be great. And I think that Islam, it is farad for us to attempt to be great. You know, I'm not much of an intellect and I don't have that type of spiritual wisdom that Imam Elahi and the many of you have. But I hope that this Ramadan, that we redefine ourselves. We redefine ourselves in the best of ways. I hope that we live, that we may learn to love, and love, that we may learn to live. We should pray for a greater righteous inclusivity, for the self-righteous exclude, claim the monopoly of truth, and are aloof. We are all God's rainbow nation. We are all the children of Adam, and we all come from the same white light that has been refracted into the colors of our rainbow. We should ask Allah subhanahu wa ta'ala to offer us inclusive excellence and participatory imaginations, that He makes us instruments of holy peace and gentleness. Muhammad sallallahu alayhi wa sallam, he once stated that he who lives for himself or herself lives small, dies small, and people will forget them. But the person who lives for someone else lives large, dies great, and will be remembered. So I think it's important that we ask our Lord that He's given us a lot. He has given us beyond of what we could have imagined. So let us live large for others. Let's dare to be different. We hope in this month of Ramadan, Allah subhanahu wa ta'ala grants us wholeness, holiness, wholesomeness, and the ability to heal brokenness. I know, I hope I didn't take too much time. If anybody has any comments of what I said, you can tweet me at realdonaldtrump. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.
Thank you so much. Really appreciate your
thank you.
Your sharing your thoughts with us. Any thoughts, Imam?
Well, you know, wonderful. I don't know, after Dr. Kamal, what can I add? You're absolutely right that Ramadan is a great opportunity. That hadith that I mentioned in the beginning, إِنَّ لِرَبِّكُمْ فِي أَيَّامِ دَهْرِكُمْ نَفَحَاتٌ فَتَعَرَّضُوا لَهَا. That in your lifetime you receive opportunities from God. So make sure that you take advantage of that. And you mentioned so many inspiring points, Dr. Kamal, that really how to make this month of Ramadan a month of solidarity, a month of understanding, a month of humbleness, and all go back to our relationship with God, our relationship with ourselves, relationship with the family, and with that Prophet upon him said that like the community of the faithful are like kal jasad al wahid, just like one body. And if one organ, one member of this body suffers, the entire body suffers. And if there is an organ that doesn't care and doesn't suffer, if there is a human being that is not caring and is not suffering, when he sees pain in neighborhood, in the country, in the world, in Yemen, in Gaza, in Afghanistan, in Syria, in Iran, in Yemen, especially in Yemen, in Libya, in Lebanon, in many other parts of the world, if someone observes all this injustice, oppression, poverty, hunger, homelessness, and showing no understanding and no pain and no suffering, Prophet Muhammad said, then this person is not like a part of this community, and he cannot even call himself a human being if he is not suffering when other people are suffering. So it's very important that a month of Ramadan be a month of fixing our relationship, repairing it, like a revolution in our relationship with God in the form of course, Siyam and Salat, but also our relationship in other people, the revolution in sense of reconciliation with people, like understanding with other people and caring. The philosophy of the holy month of Ramadan, the philosophy of this Siyam is to provide us this understanding. I mean, even the United States, the richest country in the world, a very wealthy country, superpower, with all this military might and army and everything, when we hear that over 500,000 people are homeless, and there are so many people that they are not secure even in their daily food. So this is really an issue that Ramadan tells us that really what is that we do about what is our responsibility. So it is a month of fasting, and also is a month of showing love and showing understanding to rest of the society, and everything that we can accomplish in life as success. Ramadan provides that. I mean, if prayer makes you successful, if organization makes you successful, if morality, being honest, being truthful, being humble, being educated, month of Ramadan is about all these qualities. I mean, revelation of the Holy Quran. When the Prophet Muhammad, peace be upon him, says, "Shahrun du'itum fihi ila dhiyafatillah," is a month of reception. I mean, he already, the best item in this reception is revelation of the Quran. أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان. It's a book of light, a book of guidance. Two of my kids, they were excited and asking both Jennifer and myself to buy them something, and they were very, very excited about that. And we said, well, we make a deal with you. If you decide to start memorizing the last juz of the Quran. First, we said, if you recite the Quran, like divide the Quran in 30 juz, and every day you recite, now that the school homework is less and you are at home and you have more time, what if you recite one juz of the Quran, one part of 30 parts of the Quran every day, and then just give us some point from each juz that you recite, pick up the most important thing that you think that you picked up. And my son Mahdi was very good on that. One time I remember that I said, Mahdi, you have some time that you memorize some Quran. And he said, which chapter? And I said, chapter Yasin. I said, Baba, that's very long. But he decided, and in a few days, he memorized either the entire chapter or part of the chapter. Now, the kids, they said, but the whole Quran, it might be too much. I said, what if you just then memorize the last part of the Quran? I said, is it too much? When you show them in the paper, it is just like it shows like a few pages. But in reality, memorizing the entire juz is something. But they agreed. They agreed that now they started from today, actually, that they recite, they started from Surah Abasa wa Tawalla, and every day they recite, they memorize, and also they go through the translation and pick up some words and some messages. The hadith says that لِكُلِّ شَيْءٍ رَبِيعٌ وَالرَّبِيعُ الْقُرْآنِ شَهْرُ رَمَضَانِ. Really, the spring of Quran is Shahr Ramadan. So recitation of the Quran, as you said Khalil, not only recitation, but also reflection.
Absolutely.
And deep understanding of that. So I hope that we make a decision that I want to make a resolution in the holy month of Ramadan, and whatever that makes me successful as a person, I see it in Ramadan. Quran gives me guidance and light. Fasting in Ramadan, sumu tasihhu, when you fast not only physically, but spiritually, you fix yourself. Relationship with God, relationship with people in a sense of respect and love and showing peacefulness and humbleness and many other things that really month of Ramadan is an opportunity. Layal al-Qadr is coming. Yes, we cannot get together, but as all you mentioned in virtual way, we have, thank God, this technology that it is helping us to take advantage of this. I mean, there are a lot of people that they wish to have another Ramadan. They are not there anymore. Now that we have this opportunity, so we have to take care of it. But not only fasting in physical sense, but as important in a spiritual sense, like fasting physically, fasting spiritually, fasting from anger, fasting from envy, fasting from gossiping, fasting from greed, fasting from racism, fasting from hatred, fasting from all muharramat that the Prophet Muhammad said, the best thing in Ramadan is al-wara'u an maharimillah, that you stay away from whatever is haram, whether it is a lying or backbiting or stealing or violence or whatever that is bad and is sin, whether it is deception, it is hypocrisy, lying too much, what we see in the political world, what we see in the media. So Ramadan is an opportunity to fix all of this and make it a month of love. You know, one of the things that happened in Ramadan was Fath Mecca, liberation of Mecca, that one of the Muslims that, you know, he was saying that now we are liberating Mecca and we are taking advantage and revenge. He said, Al-Yawm Yawmul Malhama. Then Prophet Muhammad assigned Imam Ali to go and change the slogan. So don't say Al-Yawm Yawmul Malhama, the day of bloodshed and retaliation and hate and killing. So Al-Yawm Yawmul Marhama. Say today is the day of mercy, the day of love, the day of compassion. So let us make Ramadan a month of compassion. Regardless of this coronavirus, you should show more solidarity and more unity, more dialogue, more understanding, and try all of us to make this world a better place for all of us.
Thank you, Imam. I would like to thank Dr. Kamal for being with us, and then really appreciate your comment, and want to ask Mahdi to join us and give a final urge to our supporters and to our friends and to our new friends and to people who are listening to help us with support the programs that we're doing before Imam gives his final speech.
Thank you, Dr. Kamal, for spending the time, quoting one of the best poets and rappers of our time. That was really insightful. So you and your loved ones, the health and safety of you and your loved ones are in the hearts of us at Islamic House. So thank you.
Thank you, guys. I appreciate it. Assalamu alaikum.
I want to spend the last few moments to wrap up by reading a couple of last letters. Dr. Talal sent a letter, and he says, among the many accomplishments of the Islamic House of Wisdom and its leader, Imam Mohammad Elahi, is its interfaith and interfaith dialogue program. the Islamic House of Wisdom serves as a catalyst in developing cooperation and understanding between Sunnis and Shias, and between Islam, Judaism, and Christianity. Its primary role is to remove misunderstanding by fostering a climate of mutual respect and tolerance, generating peaceful coexistence and harmonious social relations, and focusing on the uniformity among practices, doctrines, beliefs, and views. Thank you, Dr. Talal Turfa, for your thought-out words. Dr. Thomas G. Walsh, the PhD chairman of the Universal Peace Federation International, says, "It has been my good fortune to have known Imam Elahi for the past 30 years. Over the years, our paths have crossed on numerous occasions as we work together to promote peace and human development throughout the world. His words never fail to inspire, uplift, and call upon the better angels of our nature. It was my privilege to have visited Islamic House of Wisdom most recently in April of 2019. And at that time, I met people from every walk of life, from a wide variety of religious backgrounds, coming together in a spirit of unity, harmony, and love for one another. The Holy Quran says, compete with each other in performing good deeds. This captures the essence of the mission and work of the Islamic House of Wisdom. Thank you, Dr. Walsh, for your kind words." And to wrap up the letters that we received, I want to read the letter from the Archbishop of Detroit, the most revered Alan H. Vigneron, who writes, "Dear Imam Elahi, on behalf of our Roman Catholic brothers and sisters of Detroit, I wish to extend to you my heartfelt congratulations on the 25th anniversary of the Islamic House of Wisdom. Your vision and dedication have borne much fruit over this past quarter century. In particular, we have appreciated your commitment to promoting religious liberty and freedom for all faith traditions. I remember your participation at the gatherings we have had in recent years discussing the important and timely topic which affects all of the citizens residing in southeastern Michigan. Again, congratulations on your anniversary, and may God in his mercy bless your endeavors for peace and justice." Thank you, Archbishop Alan Vigneron, for taking the time and writing those thoughtful words. I want to refocus our attention on the Islamic House of Wisdom. You know, the difference between a believer and a non-believer is that a believer gets paid twice. By supporting the mosque, which in turn supports our community, we have the opportunity to make others happy, which make us happy. That's payment number one. But also by making our motive and our intention, our niyyah, ghurbatan ilallah, for Allah, that grants us payment number two in the hereafter. Imam Jafar al-Sadiq, our sixth Imam, says that there are three things which if a person performs even one, Allah will make sure that paradise is mandatory for him. And he says, number one, it's to give charity when one is needy themselves. Number two, cheerfulness with the whole world. You know, when I read these two concepts where Imam Jafar al-Sadiq is saying, look, if you either give when you are in need yourself or you're cheerful to the whole world, it's as if our Imam is speaking to us right now in our current situation, where now more than ever, it is even harder to give, and it is more difficult to find joy and hope in the world. But it reminds us of a key concept that they teach in life. You know, in the gym, they say where there is no pain, there is no gain. No pain, no gain. Look, it's easy to give support and share happiness when times are good. But a person with true character, who is looking to build themselves and invest in this life and the next, will give when it hurts to give. That's where we make the biggest gains. It's easy. We're not tested when times are good. We're tested in times like these. And if we want to make the biggest gains in this life and the hereafter, we must learn to give even though we may be in need, even though we may not be as prosperous as we once were prior to this pandemic. Give when it's hard to give. Be cheerful, be happy, spread the love to the world, even though it may not be as easy to do so. I want to thank all the donors, and I want to urge at this last commitment that the Quran says what? فَمَنْ يَعْمَلْ مِثْقَالَ ذَرَّةٍ خَيْرًا يَرَهُ. For every atom of good that you do, you will be given, you shall see that same weight. I want to urge everybody to please open that link that you see below the Facebook Live. Call that phone number, 313-359-1221, and support the many initiatives that the Islamic House of Wisdom has. It's not easy to put these programs together, brothers and sisters. It's not easy at a time like this when anxiety, the levels of anxiety are starting to ramp up a little bit. It's not easy to put these types of programs together to make sure that the needs of our community are being satisfied. Learn to give, make sure to be a sustaining member. It doesn't matter how much. You can't put a price on it. At a time like this, nobody's judging. Anything that you give is welcomed. On a monthly basis, if you want to be a sustaining member, please do so. Once again, the phone number is 313-359-1221. There's also a link below the Facebook Live. Pour your heart out. Speak to your Lord. And one way to satisfy him is to satisfy the needs of our community. Please do so, because by supporting the Islamic House of Wisdom, you have supported your brothers and sisters in Islam. And not only our Muslim brothers, but as we heard, our non-Muslim brothers are also benefiting from this as well.
Thank you, Mahdi. I really appreciate it. Again, I'd like to echo what Mahdi has said, which is this is a great opportunity to support. And by the way, that link is going to be on the Facebook for now. So if you didn't get a chance to now, you're going to contribute later, please do so. And I want to take the opportunity to thank Imam for giving me the opportunity to help, and thank Mahdi for the wonderful information he shared. And I also like to thank all of the people that took the time to be with us, starting with Wassim Mahfouz and his team, Dr. Ajjour, Sayyid Hamid Sadr, Dr. Mary Asseal, Hajj Hammoud, and Dr. Shady, Shebak, Dr. Kamal, Khalil, and everyone that has been with us today, those who are watching, those who are contributing, those who I know they're going to contribute later, and they're going to provide us with the support and resources needed to continue doing what we're doing and providing the services at the crucial time of need. So I want to thank you all, and I want to thank Imam again. And Imam is going to close this session with his final words. Thank you.
Thank you, Said Khalil. Your help and contribution all the time, and your volunteer works for House of Wisdom for a long time, and your services to our community as well. Thank you, Mahdi. Very, very proud of you. Any time that I hear you and I listen to you more, you make me more proud of your intellect and your integrity. You are really a gift from God to our family, our community. I want to, as Said Khalil mentioned, all the panelists today, those who participated in this virtual conference and contributed with their knowledge and their wisdom to our community. God bless your heart, your contribution, your commitment. Say to our community, we thank you and your participation. Those of you who watch this program live, those of you who may watch it and follow up later on and contribute to the continuity of the work of Islamic House of Wisdom. Inshallah, in the holy month of Ramadan, we are going to have a very rich and educational and spiritual service online. Please follow the information, the statement that we send you through WhatsApp, Facebook, text, telephone, and any means of communication. Let us be ready for the holy month of Ramadan. أوله رحمة وأوسطه مغفرة وآخره عتق من النار. Let us be part of this mercy, part of this forgiveness. Let us forgive one another. If we ask Allah to forgive us, let us forgive one another and reconcile. And if there is any things in our hearts and in our relationship, try to fix it and make it atqum min an-nar, really get free from this hell of hatred and hell of animosity and all of this, because this is what the holy month of Ramadan is about. Allah is talking about as-sa'imin was-sa'imat, a man and woman who fast during the holy month of Ramadan, and he said, أعد لهم مغفرة أعد الله لهم مغفرة وأجرا عظيما. So you are receiving a great reward from great God. So let us be ready for this holy month of Ramadan and take the message of Ramadan very seriously. يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. The purpose of this month is a taqwa, and the taqwa means protection. How during this coronavirus, everybody is talking about protection, that use like a face mask for protection, use gloves for protection, washing your hand for protection. So all they are talking about protection from a physical virus to stay safe and healthy. The same thing is about Ramadan. لَعَلَّكُمْ تَتَّقُونَ means the purpose of as-siyam is protection of your soul from spiritual viruses. So any virus, anything that is sinful, anything that is haram, that is a disease for our soul. And the meaning of taqwa is to protect your soul against all kinds of sins, whether the sins that we commit with our eyes or with our ears or our hands or especially our tongues. That the Prophet said, "Ihfadu al-sinatakum." Be careful that you control your tongue during this holy month of Ramadan, and let your al-Muslimu man sallim al-nas min yadihi wa lisaneh. Let people be protected and kept protected from our tongue and our hand. So our intention, our expressions, our actions are source of healing, source of hope, source of help, source of solidarity for the society and humanity. May Allah give us tawfiq that we be able to fast during the holy month of Ramadan, not to look for any excuse to escape from this opportunity. And may Allah accept the fast of during the holy month of Ramadan, because He said, وَالنَّوْمُكُمْ عِبَادَةٌ, when you are fasting, even when you get tired and you want to take a nap, even that nap included in the act of worship. So recitation of the Holy Quran, do prayer, especially for arwah and batina, those who are passed away, and prayer for those who are suffering from this coronavirus, praying for the doctors, for the nurses, for those people who are responding to emergencies, whether they are police department, whether there are medical society, officials of the state. We pray for all of them, and we ask Allah subhanahu wa ta'ala for al-faraj, for relief from this global pain, this global problem of COVID-19, and provide the al-Ummah al-Islamiyya and humanity with healing from this problem. Bismillah ar-Rahman ar-Rahim. وَالْعَصْرِ إِنَّ الْإِنسَانَ لَفِي خُسْرٍ إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. And we end this service this evening with recitation of Surah Al-Fatiha for all mu'mineen and mu'minat. I know my mom, Hajj Fatima Radayat, she passed away a couple of weeks ago. And then we have in our congregation, Hajj Taha Al-Khalisi, and the tragic death of Hajj Fatima Saad just a couple of days ago, and Bilqais Sadiq, many other people in our community that because of the coronavirus or because of other reasons they passed away. Let us bless their soul and the soul of the martyr, the shuhada of al-haqiqa wal-fadila, those who sacrificed their life for truth and justice. Let us recite Surah Al-Fatiha al-Arwah jami'ahum بعد الصلوات على محمد وآل محمد اللهم صل على محمد وآل محمد بسم الله الرحمن الرحيم. And also أرواح أموات المتبرعين, those who participate in donation today and days before and after during this holy month of Ramadan, for all of them. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. And last but not the least, Hajj Jennifer. God bless you, Hajj Jennifer, for your effort. I know that she did not even sleep in the last few days, getting ready for this program, organizing everything behind the scene, and the technical support that she has been supporting and doing despite of all other responsibilities and duties. We thank you, Hajj Jennifer, also for your support, and the board members and everyone. God bless you all.
Thank you to everyone. Thank you, Hajj Khalil. It goes without being said that your experience and your knowledge is something that can be measured. We thank you for your time. We thank you, Imam Elahi, for your beautiful words, and for all the guests who joined us throughout the program, to all the donors and supporters. Thank you all. You are in our thoughts. You are in our prayers, and may God bless you and your family.
Thank you so much. And I, again, want to echo what the Sheikh said in regard to Hajj Jennifer. She did an excellent job preparing this. It's not easy to put it together, keep everybody on cue, and doing outstanding work. Thank you. And I really appreciate the opportunity you guys have given me to help in this endeavor. Thank you so much. Right now.
Thank you, Hajj Jennifer. Thank you.